Bwrdd a chroeso I gyfarfod y bwrdd. Good morning and welcome to today's Digital Healthcare in Wales board meeting, the last public board meeting of 2022. As usual, normal practice, we're holding the meeting virtually, and people are being able to link live to our meeting today. And there's also the opportunity to catch up after we've finished by using the link, clicking on the link on our website, and you'll be able to see a recording of today's meeting. We are using simultaneous translation, as is our custom and practice. If you need to hear a translation of the Welsh, then if you hover on your screen, you'll see the globe and the icons towards the bottom. It's the second in from the right. If you click on that and you select Hear Translation and just leave it on that selection, then as and when people are using Welsh, you will hear a translation. Usual advice that sometimes we're not always going to be looking at the camera. That's we need to be looking at our papers, for which we apologize. And we will be taking a comfort break during the morning, and then we will be breaking for lunch at around about I think it's around about 12:15. I've slightly rejigged the order of the agenda to the published papers, because David Selway, who chairs the independent member digital network, needs to leave us at lunchtime. So we're going to take the report of the last meeting, his report of the last meeting, just before we break for lunch. Hopefully that will be suit you and be convenient for yourself, David. I would like to welcome a new member to the board, a new board member. That's Sam Hall, who's our Director of Primary Community and Mental Health Digital Services. Welcome, Sam. Sam joins us from being the Chief Digital Officer at the Welsh Local Government Association. We very much look forward to your contribution around the board table, Sam, and indeed your contribution to what is a new role for us. So welcome, Sam. And then we will be welcoming some people joining us for various items on the agenda through today. Jessica Scorer is joining us in a moment. She's the e-library and knowledge services manager, and also Michelle Sell will be joining us for relevant items of the agenda later on in this morning and this afternoon. So I'll now crack on with you to today's agenda. Apologies for absence. There have been no apologies for absence that I'm aware of. Everyone seems to be here. Declarations of interest. Marion Wynne-Jones has advised us. I think it's more a declaration of involvement, Marion, but it's good of you to notify us that there's a declaration of interest around agenda item 2.7 policy report, where we'll be approving the adoption of our Welsh language scheme. And Marion, as people will know, was chair of the Welsh Government's More Than Words Task and Finish group, which had a significant role to play in the adoption of Welsh language schemes and the use of Welsh in NHS Wales. So thank you. We note that declaration, Marion. I haven't had any others. Has anyone got anything that's occurred to them having looked through the agenda? No. Okay, thank you very much. If I move on then to the consent agenda, and as is usual, hopefully people have drawn something to the attention of the relevant officer in advance of the meeting, and that has been dealt with. If there are any issues and I haven't been advised of any, then we will endeavour to find space on the agenda for them. So I'm sure you'll pipe up if there are. Okay, so if I then move on to those things that we need to approve and note as part of the consent agenda. We're approving the minutes from the board meeting held on the 29th of September. They're subject to some minor typographical amendments. And then also, people happy for that to be approved? That yes. We're approving the minutes held from a private board meeting held on the 29th of September again. People happy with that? Yes, thank you. We're approving the minutes from the board meeting held on the 26th of October, and this is subject to a minor amendment to ensure that we highlight that the financial transfer and forecast position of the link and risk programs would need to be validated. So that minor amendment, people happy to approve those minutes? Yes, thank you very much. And then we are approving We've had a lot of meetings both since the last meeting. We are approving the minutes from the private board meeting held on the 26th of October. Oh, sorry, I've covered that one off. And then I'm asked members of the board to note the action log. 2 actions are underway. 2 are complete, and perhaps draw your particular attention to, and it's included in the board pack, the pledge that every member of the board has now signed, signing up to the values and behaviours of the organisation. I'm really pleased to see that that we've all done that, and one more board member to join us, and I know he will be. I'm sure he'll be equally pleased to sign that pledge. So happy to note that. Then noting the forward work plan at item 2.6. And approving the handling concerns and complaints policy, and the one I referred to earlier in the context of Marion, the Welsh language scheme. Are people happy to approve those 2 policy documents? Perhaps I've missed out one thing in terms of the action log, an action that we anticipate being closed by the next meeting, where Ivan Evans and Sam Hull are going to be discussing in detail the organisation's role in care. And as I say, we anticipate that action being closed by January. Okay, if I move on then to the main agenda, and as is usual, the first item on the agenda is a shared listening and learning presentation. And today we're hearing about the e-library service. So I'm going to hand over to Rydian, if you'd like to introduce the shared listening and learning presentation, Rydian.
Thank you very much, Simon, and good morning, everyone. I'm proud to introduce this element of the work that we do, Simon, because this truly does cover health and social care. The ability to access peer review literature, evidence, clinical guidance, things that reassure clinicians that they're doing the right thing, or indeed signpost them to do the right thing, is a very important part of delivering patient care. The service, which I would encourage the public, they could look online at ehl.nhs.wales, and can see some of the excellent work that is delivered by this team. So I'm not going to steal their thunder, but other than to introduce another rising star of our organisation, Jessica is seconded in for Rachel Sully, who's probably watching at home, being a recent mother yet again. So I'll hand over to Jessica. Thank you, Jessica.
Thank you, Rydian. So Bwrdd, good morning, everyone. Thank you for that introduction. If you could go to the next slide, please. Fab. So I'm going to start this presentation by introducing you to the eLibrary team, if you don't already know them, and I'll introduce you to our purpose and vision as well. I'm then going to run you through our robust governance structure and procurement process. This ensures value for money and that our users' needs are met. I'll give you an insight into our vast collection of electronic resources, which, as Rydian says, we'd really encourage you all to use, and I'll tell you how we engage with our users and stakeholders. I'll then let you know about 2 of our exciting collaborative projects. I just had to pick 2. We've got quite a few going on, but with limited time, and I'll let you know where we are with them at the moment. And I'll finally give you an insight into what the eLibrary means to our users and stakeholders. So quite a lot to cover in 10 minutes. Next slide, please. So the eLibrary team sits under the Clinical Directorate and is within the Information Intelligence and Research Department. We are a small team made up of myself as interim service lead. My role involves delivering the eLibrary's 3-year plan and our milestones within DHCW's integrated midterm plan, and covers the majority of our procurements. There's also John Dunkley-Williams, who is the librarian specialist and takes responsibility for the day-to-day running of the eLibrary and technical aspects of our e-resources. And there's Bex Merrick, the engagement and learning specialist, who leads on all things engagement and training. So the eLibrary also receives some admin support from a clinical directorate facilitator, and we are in the process of filling this post at the moment. Next slide, please. So our purpose is to provide a user-led digital collection of evidence-based information for all of NHS Wales. And our vision is to provide value for money, promote the eLibrary service to our users, empower NHS Wales to use our e-resources, and also to innovate, develop and grow our collections to ensure we continue to provide reliable resources for evidence-based care. Next slide, please. So I'm now going to tell you about our governance and procurement process. So the eLibrary is governed by the eLibrary Service Board, who meet quarterly and have representatives from our stakeholder groups. And these groups are NHS Wales Library and Knowledge Service, or NHS WLKS, Public Health Wales, Health Education and Improvement Wales, or HEIW, and Welsh Government. There is also the eLibrary Champions Group, which sits under Service Board to support them with their decision making, and this group also meets quarterly. So the group includes health and care professionals and subject matter experts to ensure that the eLibrary and the resources it procures represent the vast array of professions within NHS Wales. And a representative from this Champions group will attend each Service Board meeting. Where required with our procurements, task and finish groups are established to support these projects by exploring new resources further. And like the Champions, they help support Service Board with decision making. So as well as these governance groups, the eLibrary team work closely with digital library services from other countries in the NHS, so England, Ireland, Northern Ireland and Scotland. Together, we are the 5 Nations Digital Libraries and E-Resources Group, and we meet quarterly to support each other by sharing experiences with procurement, contract management and management of digital libraries. And I've actually got a meeting with them after this today. So as well as these groups, Bex, our engagement and learning specialist, is part of the NHS Wales Library and Knowledge Service training group. So this group works together to deliver training days and workshops to NHS Wales employees. And the training group have actually recently been awarded the 2022 CILIP Cymru Wales Team of the Year Award for their work producing a fantastic programme of literature and evidence searching webinars. So I'm really proud that their work has been recognised by CILIP. And for those that don't know, CILIP is the UK's Library and Information Association. So that's our governance, and then our procurement process. So the eLibrary regularly review all procured resources as well as new recommended resources to ensure quality and value for money. For re-procurements, we analyse usage data and user feedback each year as part of this review process. And for new recommendations, these are received directly from users via the Contact Us page on the website, also via emails and engagement activities, and via stakeholder group representatives. And the eLibrary commits to reviewing all recommended e-resources in line with our collection development policy, and we follow up with users as well to confirm the outcome of these reviews. The eLibrary then submits our procurement recommendation to the eLibrary Champions Group for approval, and then to Service Board for approval. And we then work with Commercial Services and Service Board together to write up the tender specification to ensure our users' needs will be met by the resource. Once the tender has been issued for the resource, a procurement panel is established, and this is made up of Service Board representatives as well as the eLibrary, to evaluate the supplier responses before awarding the tender and completing the procurement. And we get support from Commercial Services through this process as well. 6-month review meetings with suppliers are written into our contracts so that we can ensure our requirements are being met while the contract is running and not waiting until the end. We bring evidence to these meetings, including records of supplier response times to our users' queries. And then finally, in the lead up to the end of the contract, the procurement reviews start again. So all of this ensures collaboration, transparency and accountability for the eLibrary's decision making. Next slide, please. So the eLibrary is home to NHS Wales's largest source of evidence and digital information, including e-journals, e-books, databases, evidence summaries, professional guidelines, medicines information, and e-learning, including subject guides, training videos, and podcasts. So there's a lot of content on there. And these are housed on our website. So you can scan the QR code on this slide, or as Rydian said at the start, you can go to elh.nhs.wales. And then once you're at the site, there's an option for Cymraeg in the top right corner. On the website, there is a search bar on the homepage, which is the top right screenshot on the slide. And this takes users to Library Search, our eLibrary catalogue, which is the bottom right screenshot. And this is where users can search through the whole of our collection. But we are always keen to embed our e-resources into clinical systems to benefit clinicians with evidence-based information at the point of need when treating patients. So for example, last year, the eLibrary worked closely with the Nursing Care Record Project to link nursing resources such as the Royal Marsden Manual into the system to make accessing evidence where care is delivered even easier. Next slide, please. So the eLibrary is a user-led service, and we continuously engage with wide and diverse audiences through social media, live and recorded webinars, podcasts, and virtual and in-person events. We also support users through help guides, videos, and offer one-to-one online support through Microsoft Teams chats and video calls after receiving requests through our service desk tool. We also engage with our suppliers of e-resources, ensuring that views and priorities of NHS Wales audiences are received and acted on in order to meet the needs of our users. Next slide, please. So that was a very quick whistle-stop tour of the eLibrary, and I'm now going to briefly highlight 2 projects that the eLibrary are very proud of. So the first is the Single Sign-On project, which has involved collaboration between the eLibrary, DHCW, our stakeholders, and Cardiff University. So Single Sign-On allows users to easily access digital content using their NHS Wales email address and system password, without the need to also self-register for an Open Athens account, as this will automatically be created for them when they sign in. So Open Athens is our authentication system that we use. So the pandemic accelerated this project and it enabled more users to seamlessly access evidence-based information to support their practice during this unprecedented time. Although self-registering with Open Athens is no longer required, currently users still need to sign up for a library account in order to access e-resources. But the next stage of this project is to achieve true single sign-on, where users will be able to access e-resources with only their NHS credentials, and this will ensure truly seamless access. And the second project I'd like to highlight is the Social Care Worker Provision Project, which is in collaboration with our stakeholders and Social Care Wales. So from January 23, so not long to go now, we will extend access to our e-resources to social care workers across Wales, and this is including those who do not work directly alongside NHS Wales services. So they will be able to access via Open Athens. And in anticipation for this rollout, the eLibrary have procured social care e-journals and databases, and further social care e-books are due for procurement in the new year. So this project is a really fab project, and it will ensure evidence-based information is available to both health and social care, improving the patient experience. Next slide, please. Cool. Next slide, please. I don't know if it's changed for everyone else. I can still see that. Oh, fab. Sorry, that might have been my delay. So before I finish, I just wanted to share with you an insight into what the eLibrary means to our stakeholders. We're always seeking feedback via Service Point and following training sessions and support sessions in order to continually improve our service. And these are just some examples of the feedback my eLibrary colleagues have received over the past year. So these are before I started last month, so I can't take credit for any of them. And then if you could pop to the next slide. There's just a few more. I'll leave them up on the screen for now, but that's all from me. Thank you very much for your attention this morning. And are there any questions?
I'm sure there will be, Jessica. That was great. Ridgeon, did you want to come in or no?
I'll do my best.
I'm very grateful for Jessica and the team and Rachel for that. I hope you spotted the engagement program photo chair. We were able to give Judith Paget an EHL bag for life. And I'd just like to say it's a bag for learning for life. So I hope you spotted the way we managed to put that into the program. We'll take some questions.
Excellent. And I'll come back in a minute. I've got Alistair and Marion and then Rowan.
Thanks, Chair, and thanks, Jess, for a really interesting presentation. Really found that tremendous, and I was so struck by the amount of resource that you have run through that's available, and just thinking through the capabilities of this, the extension of this to, if I heard you correctly, Jess, to all social care workers in Wales, I'm not aware of any other mechanism through which we can reach all social care workers in Wales that has a Wales public sector focus, let alone NHS and social care. And I think it's something that we really should explore, just how that can be developed. So, for example, they are in many ways the field soldiers who are supporting people who require care to stay and live independently in their own home, and hopefully they will be happier. They generally feedback they're always happier in their own home. And of course, the prevention of those people entering our hospitals in avoidable ways. So the way in which we can stimulate and develop through social care workers prevention and the potential for stimulating knowledge about healthy lifestyles would be something I think I'd be very, very interested to see how that can be explored. They're people who will benefit from access to information about healthy lifestyle, and they may well be able to move this on to the people that they care for. But it seems to me that it's a really, really interesting new opportunity with a resource that could be expanded in very interesting ways. So I really appreciate the outline. Thank you.
No, thank you. Oh, sorry.
No, go on, Jess. Go on, Jessica. Go on, go on.
No. That was a really good point, a really excellent point. And we've established. I didn't put it in the presentation. I should have put that in. But when I mentioned task and finish groups, we have one of those for the social care provision project. So we'll be working with them continuously. Just because it's been rolled out, that doesn't stop there. We'll have training programs established, social media campaigns, and to try and get the word out there to everybody, and make sure that all social care workers are aware that this resource is here and that they can have input, and we can expand as time goes on. But thank you.
Marion. We're not hearing you, Marion, but it doesn't look like you're on mute, which is strange.
Got it, thank you.
Got it? Yeah, we've got you.
I'll be speaking in Welsh if I may. Diolch yn fawr. A diolch Jessica, diddorol iawn o clywed am yr adnod gwych yma sydd ar gael. A dod i ddeall mwy am yr amrediad eang o wasanaethau chi'n gynnig, ac yn galonogol iawn clywed am yr ehangu i faes gweithwyr cymdeithasol fel y soniwyd gynne. Mae gen i ddiddordeb gwybod i ba raddau dyn ni'n cyrraedd holl weithwyr y gwasanaeth iechyd. Pa ganran o'r weithwyr sydd yn ddefnyddwyr rheolaidd o'r adnod gwych yma, ac os oes angen cynyddu ymwybyddiaeth ag ehangu'r nifer o ddefnyddwyr, beth ybed allwn ni wneud i gyrraedd cynulleidfa ehangach? Diolch.
Thank you. No, I think that's a really good point. I can't give you off the top of my head any percentages or anything like that, but I will take that away because that is a really good point. With our usage statistics, we use a system called Counter, and this will record numbers of usage, and we can work that down to health boards, so we can work out how many users in each health board are using the resources. But in terms of breaking down further than that, I'm not aware of a way that we can do that with the system. But in terms of speaking with our stakeholders and our task and finish groups, service board representatives, all of these useful resources and contacts we can use to help reach out to as many people as we can, and to also receive their feedback as well. But I do know that we do need to do more work to make sure that we're expanding out to more and more of our users, because we have feedback surveys, but of course these naturally aren't going to be filled out by everybody. So that's definitely something that we need to work on. But we're always taking on board feedback from our stakeholders for any groups that we're not reaching. But yes, great. Something we will continuously work on.
Rowan and then Helen.
Simon. Hi, Jessica, thank you for that. And I particularly was interested in the point in your presentation where you referenced enabling people to be prompted with context-sensitive information in the course of their work. So not just relying on people to go and find information, but actually pushing information at them where relevant. And I know that in the UK at the moment, we're changing some of the copyright laws as we come out of the EU to allow more processing of what essentially is unstructured data. So how are we planning to build on top of this resource to do more pushing of information out into decision making across the clinical areas? Be really interesting to hear the thoughts on that.
Thank you. Well, in terms of your copyright point, that kind of resonated with me. So we're doing our re-procurement of the CLA, the copyright license procurement at the moment, and part of that is CLA Plus, which is a collaboration kind of part of CLA, and that will allow us to kind of share a lot more information when we work outside of our organisation as well. So that's really exciting. We do have it as part of it now, but we've kind of honed in on the tender specifications for the next procurement. So that's great. There's also a ongoing project, but it hasn't launched yet, called Lean Library. And this is a browser extension, which the plan is to have this rolled out across the all of NHS Wales. And this is, I'm not sure if it will answer your point, so please let me know if it doesn't, but this allows pop-up messages to come up and help direct people to, or users to, resources that we have access to. So they could be on Google, for example, looking for, guidelines on XYZ. And this pop-up message will automatically help direct them to resources that the e-library have access to, or open access resources. So it's and it's only academic resources that will be through that plugin. So to really help direct users without needing the confidence necessarily to go and find it themselves. Of course, we'll still be working on that. We think it's really important that our users know how to find the information, but this will just be a useful tool, especially for user groups like the social workers. You know, they're new to the e-library, but we think that will be a really fantastic tool to help with that. So I'm sorry, I hope that answers your question.
Thank you, Jessica. Ro, did you want to come back? I
think it's worth following up with maybe Jessica and Rydian in more depth, but I think that's probably enough for the board meeting. Otherwise, we'll consume all the time chatting on that point.
Okay, Helen, and then
Definitely.
Andrew, and then Marilyn. Helen.
Thank you, Chair, and thank you, Jess. Excellent presentation, really helpful. And thank you to you and the team. And I think the e-library service has gone from strength to strength over the last few years. So I think it's achieved some fantastic things. And congratulations to Team Wales, actually, on the Team of the Year award from CILIP as well. I think that's a really good accolade. And I think the resources and the engagement actually kind of, that's why, isn't it? That we're doing some really great stuff in Wales. Marion pinched my question, actually. So, and I am conscious that you are fairly new into your interim position as well. So this may be an unfair question. So if you don't know the answer, that's fine, but we can follow up after. But I was just wondering, what's the most popular, which areas are the most popular kind of resources that people access across Wales?
I don't think I could give you an accurate answer, but I do think that's a really good point. And I'm sure my team would know that, but I will definitely follow up with you on that one. And maybe we could do a form of news item or something like that on our website to, top 5 resources or did you know we've got these, that kind of thing. So yeah, no, that's a good point, and we'll follow up on that.
That's great. Thank you, Jess.
Thank
and well
you.
done.
Andrew. Oh, we can't hear you, Andrew. But again, you're not sure. Oh, that's it. Perfect.
Apologies. Welcome to Digital Health and Care Wales, by the way. And yeah, somebody who uses the library professionally, I just wanted to compliment the work of the e-library service. And I recommend the members to have a look what's available. It really is a wealth of information. There's a lot of resources you can request texts if you want to. So it was just to say that really, and just acknowledge that everybody is really enjoying the experience of having a new library service, and we watch with interest as it develops further, because it really is brilliant.
Thank you, Andrew.
Thank you.
Marilyn and then Ruth.
Bwrdd, Jessica, thanks Chair, and thanks Jessica for that great presentation. I was just wondering, on reading the information, I was wondering, you talked about lived experiences, and I've got a background in equality and diversity. I was just wondering, and I know you're fairly new, but going forward, whether there might be any work we do in identifying any gaps we have within the information that we've got, to try to sort of expand the library in some ways, because when there's been reports highlighted, for instance, recently with the COVID-19 Welsh Assembly Government report, it talked about disproportionality around health for people from Black, Asian and minority ethnic communities. So I'm just wondering, the lived experiences, whether there's any work that we could do with DHCW and just sort of highlighting that and getting the information out, like you said, to people, and encouraging people to get that information so that we can add those medical information to clinicians and people who work for us. So.
No, that's a really, really good point. I really like that. And I can't give you an answer right now, but I would love to follow up with you on that. So I've jotted down your name to follow up on that one. But a really interesting point. Thank you.
Happy to do that as well, Jessica. Thank you.
Fab.
Yeah.
It's almost like one of those ways you could use that pop-up functionality, isn't it, in terms of pushing that sort of information to people that they might not otherwise be aware of. Ruth.
Thanks, diolch, Jessica. That was a really interesting presentation, and again, I commend the work that's been done. Just to change the mood slightly, I just wanted to finish on the finance side of this. I think we need to recognise that as well as the time and effort put into this, there is a significant investment that we're making on behalf of the NHS in Wales to support the wider system. We know we've seen at the board procurements for some of the journals and some of the systems that Michelle has brought forward to us. So I just thought it was worth recognising that this is an investment that we make on behalf of the NHS in Wales, and we should make sure we recognise that, as well as recognising all the good work that's gone into this.
Yes, and from my recollection, we did it last year, didn't we? And it's not an insignificant investment, but a good investment. And Andrew, did you want to come back in?
Marion said something on it. I'm sorry, Marilyn said something, and it triggered something off in my mind. There's a lot of resources out there that are procured directly by services, and this brings me back to a conversation I had with the library service before you started, and it might be really good to bring those in centrally, because some of them are really expensive to buy as an organisation separately. But if the library service was to buy that or procure that centrally, it could be available to a greater number of users. So it's just a point to make, really. There's one particular product I had in mind that would be useful to us, but it costs a lot of money.
No, I definitely welcome conversations about that. We really like to have recommendations, and if we can have a once for Wales with our procurements, then we're definitely in favour of that. So no, I'd welcome conversations from everybody with any recommendations, because we have our robust governance structure, we have our robust procurement process, so we can make sure that any recommendations go through all of that. But obviously we need the recommendations from everybody to know that we're getting the right things for our users and our staff who are users as well. So no, we'd definitely welcome those conversations. Thank you.
No, that makes all sorts of sense, and picking up on Ruth's point, if we take over the procurement of an item, then we ought to be taking over the funding of it from wherever it was originally. Claire.
I just wanted to qualify the amount. So just for everyone's knowledge, Welsh Government fund us 4.4 million annually directly to fund this resource. So it's something that as an organisation we took on responsibility for from HCIW. So it's something that we do on behalf of Welsh Government.
Thank you, Claire. Any other questions or points? I just got one, Jessica, because I've already used the QR code and poop straight through on my phone. But so where does that mean we are in the single sign-on then? I'm a bit confused. If I can go straight through on my phone into the library via the QR code, then that's signed me in already. Is it automatically? Is that how it's worked?
So it was the on library search. So on the slide with the collections, if you access through library search, there's an option on there to sign in with your NADEX, your NHS credentials. If you accessed it directly, there should be an option on that resource for institution login or Open Athens login. It's slightly different wording on each resource, and that's where you can again do your same login details that way. Sorry,
right,
I don't think I was very clear on my
I'll have to
access is controlled.
I'll have to
control.
Yeah, I'm gonna have to practice and explore it.
You can land on the page, but when you choose an article, when to see the article, that's the point where the
that's the point at which it will ask me to log in. Okay.
And if you haven't yet, it should prompt you at that point on the resource. If you haven't gone to the institution login, it will prompt you, so you'll be aware.
I like a good e-library. Jessica, that was really fascinating, informative, and hugely useful. And I hope we all explore the resources that are available in the library. I shall certainly be having a little play around in it later on today. So Jessica, thank you very much indeed for the presentation, and good luck in what is obviously a relatively new role for yourself.
Yeah, started last month.
Oh, well, so good luck. Congratulations. Anything else you wanted to pick up on, Rydian, before we move on?
No, just to remind our listeners, EHL, so the Electronic Health Library, .nhs.wales, available to health and social care workers across Wales.
Thank you. Thank you. So if we move on then to my report, and just to ensure the sort of the smooth running of the board meetings, that when those of us who are picking up on written reports or written reports of committee meetings or minutes of committee meetings, then they're obviously there for everyone to read in full in the papers. So I think what makes all sorts of sense is to pick out some specific issues that are really we'd like to draw to your attention from the reports or from the minutes. And I've got three I'd just like to focus on today from my report. The first is the Senedd Health and Social Care Committee and the Public Administration and Public Accounts Committee attendance review inquiry that we attended towards the end of last month. That was attended. I think we had. I reported in my last the last meeting. It was just about to happen. It was on the 26th of October, as I recall. So myself, Helen, Rydian, and Claire attended that for what was a long session. It ran over time, and I think we were pleased with the level of interest in our work and the sorts of areas that were being explored. And I think we were comfortable that we were able to get across some key messages about the extent of the work that we're doing and the importance of the digital developments in health and care. And I think we all ended up, both committees and ourselves, on exactly the same page in respect of fax machines, that we wish to see the back of them. And interestingly enough, Ofcom have currently consulting on switching off the requirements to for the telephony suppliers, BT mainly, to supply fax enabled telephone lines. So we just on finally on this point, there are a number of areas that we're following up individually with specific MSs who had particular areas of interest, and I've got a meeting with one of those prior to Christmas with a couple of our officers to discuss issues around data and the use of artificial intelligence, and we're also picking up on a number of areas where they asked us to go back with further information. So the committee inquiry, the joint committee inquiry has opened doors for us, I think very useful doors for us to have conversations around the priorities and the importance of digital developments in health and care in the future. The second bit I wanted to highlight was in my report is that a digital program governance review has now kicked off, which is now a jointly commissioned review by ourselves and the Welsh Government, being led by an individual called Steve Coombe, who was until fairly recently the board secretary at Swansea Bay Health Board, and he also, as I understand it, provided a lot of support setting up the governance structures around DHCW itself when it was being formed. And this is going to look at the way in which the various programs, that considerable number of programs that are being run on specific digital applications, how they fit into the wider governance structure, into our governance structure, and looking at the roles and accountabilities of individuals and organizations like the program boards and the SROs. So that we're hoping, and Chris will nod, that will be a quick piece of work, and we are expecting a report with luck this side of Christmas, I think, isn't it, Chris? Yeah, with this side of Christmas, that we can have a conversation with the Welsh Government about early in the new year as to how we might follow up on the observations that Steve Coombe reaches in that review. And finally, Helen and myself attended a meeting with the Minister yesterday, and as you would expect, there was a considerable focus on the pressures that the system is currently under, both in terms of winter pressures and in terms of backlog around planned care. A considerable focus on that, and a recognition that lots has been done that has already had an impact, and that things would be potentially much greater, in a much poorer state than they currently are, had those things not been done. But the bit I wanted to highlight was that the Minister a couple of meetings ago asked for digital to go on the agenda, so it was on the agenda yesterday, and Helen gave a presentation, and the critical thing here was that this was a presentation very much not in DHCW priorities for digital future in health and care, but the system priorities for a digital future in health and care. And I was encouraged, I think, by the number of chairs who picked up on the fact that it was a system issue for them, and that there were system difficulties and challenges in securing the levels of investment that are needed to really ensure that digital does have plays a full part in the future in health and care. So I thank Helen for the presentation. She did the heavy lifting on this one yesterday, but we were able to get some key messages across, I think, around our priorities and those being shared across the system. So those are the three bits I wanted to pick out. If anyone's got any questions on the wider report, please do put your hand up, or if anyone's got any points they'd like to make on those three that I've just highlighted, then again, please put your hand up. If not, I'll move on to the next item of the agenda, having asked you to note the content of my report. Okay, thank you very much. If I could now invite you, Helen, to present your report. Yeah, please.
Thank you, Chair. And yeah, similarly, just to pull out some highlights then, because colleagues will have seen the report in the papers. Just to say that 2.2, the item concerning link and risk, is on the agenda, so I won't cover that in my update, because Michelle will cover that later. So if we go down to 2.11, I really wanted to call out the great work that the team's involved in our recertification of 2 of our ISO standards, our quality standards. We achieved recertification this month, so ISO 9001, which is quality management systems, and ISO 14001, which is environment management system, sorry. So yeah, really well done to the teams involved in that, and really good accolade to get that recertification. 2.12, I am extremely pleased to inform the board that we have had a successful implementation of the digital health and care record into the Bwrdd Cancer Centre. That was, we're in the second week of that, so that went live on the 14th of November. And we had a exec to exec discussion actually with colleagues at Bwrdd and NHS Trust yesterday. So really great work that's been happening across the teams. And actually, I think one of the reflections, and the teams are continuing to work through the bedding in and, you know, any sort of new process issues and that need to happen. But I think the greatest feedback that we've had is it was very difficult to identify who was a DHCW member of the team and who was a Bwrdd member of the team. So they really came as one and have worked around the clock to make that a success. Lots more work to do to get the system bedded in, but yeah, there were lots of smiles on the call yesterday, and so I just want to say thanks to our colleagues at Bwrdd for all of the hard work that they've done and all of that process redesign that has been taken forward there. So, and thanks to our teams for a huge amount of effort that's gone on right across kind of numerous teams in the organisation to make sure that we could get this over the line. And then I'd also like to call out 2.15. We have won the best place to work in IT in the UK from the British Computer Society UK IT Industry Award. So I am tremendously proud actually that the organisation has been recognised for that. There was huge competition and quite a lot of people on the shortlist as well, and some big players there. So I'm really pleased. We were commended for our commitment to diversity and inclusion and the development of our skills and career development for our staff. So yeah, huge well done to all of the teams in DHCW for that one, and particularly to call out Sarah Jane's team in terms of the work that they've been doing to support that from a people and OD perspective. And then just finally on the awards, just like to call out Ridian's team. So a couple of recognitions for Ridian's team over the last few weeks. They had a recognition award at the recent Health Data Forum for the great work that they were showcasing that we're taking forward in Wales. So I think that was a really good recognition of that. And then hot off the press from yesterday evening, the HET Innovation Excellence Awards, I think they're called, but the team who have been working on the looked after children data have won 2 of the awards. They were shortlisted in 2 categories, so they won the Best Integrated Care Collaboration. And I think my favourite award title, they won That Will Never Work award. So the most creative and disruptive solution. So fantastic achievement for the team there. And they look very glamorous on the pictures that I saw last night. So yeah, huge congratulations, and hopefully they enjoyed the celebrations. But yeah, very proud of them. So just wanted to share that with the board. Thank you, Chair. Happy to take questions.
Thank you, Helen. And if anyone's listening from a social media channel that used to work at a social media channel, this is the place to work. Rowan.
Just a comment really, Helen. You know, the work that's going on at Bwrdd. I just wanted to reflect really on Ridian's leadership. It's a phenomenally complex project. Ridian, it's been one of the highest risks that the organisation is carrying, and I think you've done a tremendous job. I know we're at the beginning of the mountain. There's still a lot more to do, but I think just steering what is an incredibly difficult program of work, and the skill in which, to Helen's point, we've been able to bring the clinical community with us is tremendous. So I just wanted to take the opportunity to say that, Ridian, well done.
No, absolutely. It's a hugely important step forward, isn't it? And as you say, Rowan, the start of a journey that I'm sure will be completed equally as successfully over the coming months. Anyone else got any questions or comments on Helen's report before I suggest we take a brief break? Okay, if we take a 15-minute break, so it's now 10:02, so I suggest we come back at 11:05. If people could switch off their cameras and microphones and then be back here at a moment before 11:05. Thank you very much. I've got no camera showing now. Why would that be?
It was doing that with me the other day. My face wasn't showing again, but mine's working now.
Hmm?
It was doing that with me the other day.
It should be on this camera. Do you know how to fix that?
I restarted Teams. I did ridiculously when my camera disappeared earlier in the week because I was using Zoom.
Simon, it's Ivan here. Yeah, sometimes the different applications on the computer, they all fight it out for the camera, and one of them hogs it basically. So sometimes closing Teams down can release the camera, which comes.
Yeah.
Might you have flipped the switch on the front of your laptop, which sometimes, oh, there we are.
Apologies, folks. So I just learnt a new rule. Don't suggest anything wrong with Elon Musk prior to a break because he gets into your system apparently. Okay, apologies for that. I had a bit of a technical problem and then the camera wasn't working, but everything seems to be back and running. But we are hopefully we'll catch up the time. It won't have a too much of an impact. So if we move on then to part 5, strategic items, and if I could invite Claire Osmondson Little, Director of Finance, to introduce our estates plan, which we're going to be asked to approve after discussion. Claire.
Diolch Simon. Diolch Simon. Bwrdd da. Well, as we all know, COVID and working from home for most has meant that we have completely changed the way that we work. And that has really led to what we do in DHCW, which is a hybrid way of working. And what that has meant for us is we've seen a significant reduction in the use of our office space and office capacity. And my role is leading of corporate services together with our estates team led by Julie Ashes, really to look at how do we best provide constructive and effective digital space for us as a team to work in. What has happened during COVID, though, is that the Cardiff office has become a central hub, not just for DHCW, but for other organisations and peer groups across Wales. And we saw that only last Friday when we held in our innovation space both the Directors of Finance and the Directors of Digital meeting, which was very effective. But equally, as Marion will know, Andrew, through the Audit Committee, we've also developed our decarbonisation plan. And as we know, the estates plays a key aspect of our footprint and a key contributor to our CO2. So we find ourselves with an underutilised estate, a backdrop of rising energy costs and energy pressures, but equally, the space that we currently have doesn't really fit the new organisation and the way we want to express ourselves in terms of being a digital, innovative and exciting place to work, designed to enable that to happen in the most effective way. So the space that we currently have, we've inherited, and we really feel that we want to stamp our identity and make it serviceable to a new digital organisation and a new ways of working. So our current footprint is 6 offices across Wales, again managed by the corporate services team. And the aim of this report was really to highlight that current footprint, to look at its usage, its costs, and to consider then, given the backdrop of a new organisation, a new digital organisation with a new hybrid way of working that needs to demonstrate a sympathetic and appropriate CO2 footprint, and also to consider the opportunities of when we could migrate to that service in line with some of our contract arrangements. We laid out our estates plan for the next 3 years, which is really up for the board for approval. And what that plan recommends is really to modernise our our offices or our hub within T Glanrafon in Cardiff for this financial year to really provide that environment to suit a modern collaborative working space, but also to work in consultation with our staff to redesign our footprint and to consider the current usage and look at opportunities to change the occupancy in some of our key footprint areas, and also to work and look at new alternatives. So what we've also seen during the COVID is opportunities with partner organisations and together with shared services to have local hub arrangements to meet and collaborate together in conjunction with our Microsoft Teams. So if then after our consultation process that we decide to exit some of our key offices, then obviously that would be done in collaboration and consultation with the staff and also with our trade union representatives. But we thought it was important to present the board our plan, the motives for that plan, and to ask you agree and approve the recommendations to move forward with that in mind. So I'm happy to take any questions on the documents that we've presented this morning.
Thank you, Claire. Does anyone have any questions or comments on the plan? We've obviously had an opportunity. Ruth and then Alistair.
Diolch, Claire. I did have a question planned, but Claire actually picked it up when she spoke about consultation with staff, because I think the important thing is this is about us having the right working environment for our staff so that we can deliver what we need to deliver in the right way. So it's not about we need to just get a complete change or anything like that. It's about we need to have the best environment possible. So in terms of our assumptions, one of my assumptions would be that would be a two-way conversation that we're having with people who work in those environments, because actually people need different things, particularly in a flexible working space, that we might not understand, given that most of the business we do is fully online. But actually, when you're working more in that hybrid way on a weekly basis, it's about that conversation with our staff. So I was pleased to hear that Claire picked that up. Thank you.
Thank you, Ruth. Alistair.
Yes, thanks indeed for the presentation of the thinking behind this as well, Claire. I was very interested in the potential for co-location, recognizing how important it is that we are both seen and recognized for who we are. We're also living through very challenging economic times that the whole of the public sector is working through, and it potentially plays well into that, and important to do so. But almost more important than those factors, it seems to me, is being able to be on a day-to-day basis, outward looking within the broader system of the public sector within Wales. So making those day-to-day connections with other key organisations seems to me something that could be extremely beneficial for our organisation through our staff, and equally through our potential partner organisations. So I'm very interested in how that could develop, and it's clearly not set out in the details today, but it's certainly something I'll be interested to see how that develops. And would definitely say that the point about it not only being NHS organisations, but the wider public sector bodies, I'd encourage that. That they are themselves looking for, in many cases, looking for co-location or partner organisations to be very connected with. And I think that's a very interesting development. So thanks for setting it out.
Thank you, Alistair. Marilyn.
Thank you. Just following on from what Alistair said, really, about looking at the collaboration of potential people we could work with, and also looking at the potential of people that who might come to us in the future. So as well as us looking at we currently employ, looking at the future employees as to the way we work, whether there might be any barriers for them, or whether we might have to change slightly to encourage people who don't currently work for us. For instance, I know for my public sector partners, people who are employed at the moment, I noticed from the records it said more people were coming into the office, and that's something that I think has been seen across the board. So it might be that some people who want to work with us want to do more of the actual physical location rather than the hybrid because their home circumstances and their financial positions. So I just wanted to flag that bit.
Yeah, absolutely. Thank you, Marilyn. Rowan. Can't hear you, Rowan, but you're not on mute.
Microphone. So just supporting what's gone before, and to reflect on this is a conversation that's going on in workplaces across the UK. I know, one very large marquee corporate that has already sort of decided on sort of 4 modes of working. So, there are the corporate offices. They expect people to be in the office on average, maybe just 1 day a week. But, there'll be home working if that's the safest and most appropriate place for colleagues to be based, but also exploring things like memberships of some of the flexible office spaces where perhaps, we can know that we've got an ability to book meeting rooms around the country nearer some of our collaboration organizations, and then recognizing, maybe it's a coffee shop. I'm a little bit more unconvinced about that, given the subject matter of what we discuss, and the need for patient privacy. But I think we are working in a much more flexible age. And Claire, I commend you and the team for starting the conversation, and I'm sure Andrew and all the other colleagues will lean into this to build a better and more flexible solution. So yes, I'm very happy to approve and look forward to the outcome.
Thank you, Rowan. Andrew, you wanted to come in.
It was just to say really that we look forward to continued collaboration around this, and we are very much aware and involved at the moment, and I think it could present many opportunities actually. It's not to work in a very different way, make more local places available to people as well as their home base, and at the same time have attractive accommodation that we might that will be able to champion what we do.
Thank you, Andrew, and thank you everyone for those comments, contributions. Claire, anything you wanted to come back on? If not, then I'll just invite the boards whether they're happy to approve the.
So I just wanted to say we really want to design collectively the right space to retain that title of the best place to work in IT. So we attract the right skills, but also going to Marilyn's point, it's a hub. So anyone can join and have the right conversations. But again, I think it's important that we are proactive, we have the conversations, and we design the space collectively, and hopefully that might win awards in itself. But it's really to now we've gone to a new era post-COVID, is really trying to ensure that the working space works for us. And I look forward to doing that. Thank you, Chair.
Thank you, Claire, and thank you and the team who've worked on this. I'm sure this, as is always the case, it's not just the person presenting. There'll be a lot of people having done a lot of work on bringing the plan to its current state, and indeed a lot of work still to go on the basis of the plan. So are people happy to approve it? Yeah, I'm sure you are. Thank you all very much. If I could move on then now to invite Carwyn Lloyd-Jones, the Interim Exec Director of Operations, to bring us up to date on data centre move.
Diolch yn fawr, Simon. Bore da pawb. Mae yna bapur yn y pecyn sydd gyda'r gwybodaeth diweddaraf am ein prosiect I drosglwyddo un o'r canolfannau data sydd gyda ni I leoliad newydd. I fynd gyda hwn, wedi moyn rhannu rhywfaint o wybodaeth gyda'r bwrdd am ein canolfannau data, achos bydd fe'n neud yn rhwyddach I ddeall beth mae'r prosiect yn trio gwneud. So, lle gael y sleid nesaf, please. Mae gyda ni ddwy ganolfan data mwyn cael argeuledd uchel a chydernid. Mae systemau ni yn cael eu lleoli yn y ddwy ganolfan data, fel yn bod ni'n medru cadw I ddarparu gwasanaethau digidol. os bydde problem gyda un o'r ddwy ganolfan, a hefyd i alluogi ni wneud gwaith cynnal a chadw heb effeithio ar y gwasanaethau digidol. Mae'r canolfannau data yn leoliadau diogel sydd gyda chyfleusterau pŵer ac oeri cadarn iawn. Mae'r offer prosesu a storio data, hynny yw gweinyddion y rhwydwaith ac ati, yn wahanol. Mae rhain yn cael eu lleoli yn y ganolfan data, ond ni'n gallu symud nhw rhwng y canolfannau data, a hwn yw ein cynllun ni gyda'r prosiect yma. So mae'r ganolfan data gyntaf, sydd gyda ni, canolfan data 1, yn gyfleuster newydd, symudon ni mewn i hwnnw llynedd, ac mae hwn gyda'r rhwydwaith modern newydd hefyd. So mae canolfan data 2, sef yr un ni'n sôn amdano fan hyn, yn gyfleuster tipyn yn hyn, ac mae'r rhwydwaith hefyd wedi mynd yn hyn. Ond yn fwy pwysig na dim, mae'n contract llytia ni'n dod i ben yn mis Mehefin blwyddyn nesaf. Felly, rydyn ni wedi creu prosiect ar gyfer trosglwyddo canolfan data 2, a cwmpas y prosiect yw i gaffael canolfan data newydd, cytuno ar gyfnod o estyniad ar gyfer y ganolfan data bresennol, achos fyddwn ni ddim wedi symud allan cyn mis Mehefin, a mae hwnna wedi cael ei gytuno gan y cyflenwr presennol. A byddwn ni wedyn yn adeiladu'r rhwydwaith newydd yn y cyfleuster newydd, a wedyn yn olaf yn symud yr offer y gweinyddion i'r cyfleuster newydd. Sleid nesaf, sgwrwch yna. So dyma lun o tu fewn i un o'n canolfannau data ni. Fel chi'n gallu gweld, mae yna resi o gabinetau ac mae rhain, so yna beth chi'n gweld ar y chwith ac ar y dde, wedyn chi'n gallu gweld bod rhain yn llawn offer sy'n prosesu a storio'n data ni. So yr gweinyddion, y rhwydwaith, y waliau tân ac yn y blaen. Sleid nesaf, please. So, ar y sleid yma, mae chydig o wybodaeth am y broses caffael ar gyfer y ganolfan data newydd, beth oedd yn bwysig i ni ac yn y blaen. So'r bwriad yw i ddyfarnu'r contract yn mis Rhagfyr mewn rhai wythnosau. So, wedi rhestru ar y sleid fan hyn hefyd, mae rhai o'r pethau oedd yn bwysig i ni fel sefydliad. So, na fi'n trwyddo rhain, esbonio bach yn fwy. So, lleoliad y ganolfan data, mae rhaid i bod ni'n ddigon agos i'r ganolfan arall sydd gyda ni i alluogi ni gael cysylltiadau rhwydwaith cyflym iawn, ond ddim yn rhy agos fel bod problem yn yr ardal yn effeithio ar y ddwy ganolfan data. Hefyd, ni moyn bod e'n rhywle le bydde'n gweithwyr ni'n gallu'r teithio digon cyflym os oes problem neu os angen wneud gwaith yn y ganolfan. Wedyn mae'r peth pwysig arall wedyn wrth gwrs yw'r diogelwch ffisegol, so i gadw'r offer sydd gyda ni mewn yn ddiogel. Systemau pŵer ac oeri gwydn. Eithronrwydd ynni, a Claire wedi sôn tyma bach am hynna o ran ein swyddfeydd ni ac yn y blaen, ond mae hwn yn rhywbeth pwysig iawn mewn canolfannau data, a mae hwn yn dod o'r ddwy ochr o safbwynt yr amgylcheddol a chost yr ynni. A chi gael rhyw fath o syniad, mae'r ganolfan ddata yn defnyddio tua'r un faint o drydan, rhyw 402. A wedyn mae cysylltedd rhwydwaith dda yn arbennig i rhwydwaith y PSPA. So hwnnw yw'r rhwydwaith sy'n cael ei ddefnyddio gan y sector cyhoeddus yng Nghymru. A'r PSPA sy'n cysylltu'r canolfannau data i'r ysbytau a'r meddygfeydd teulu sydd ar draws Cymru. A wedyn wrth gwrs hefyd yn bwysig oedd y costiau. So costiau ar gyfer y cyfleuster, a wedyn costiau ar gyfer yr ynni ni'n defnyddio yn y cyfleuster. A wedyn roedd gyda ni ofynion hefyd am y broses a chostiau mudo, so y pethau o ran y gost o symud yr offer. A wedyn ni hefyd yn chwilio am fecanweithiau i leihau'r costiau rhedeg deuol gyda ni, achos bydd angen i ni gadw'r ddwy ganolfan data, yr hen a'r newydd yn rhedeg am nifer o fisoedd. Mwyn i ni gallu gosod y rhwydwaith newydd, profi'r rhwydwaith a wedyn symud yr offer sydd gyda ni dros gyfnod o ryw 2 fis. Sleid nesaf, please. So, bach o wybodaeth fan hyn am y rhwydwaith newydd. So, bydd yr rhan fwyaf ohonoch chi'n cofio ein bod ni wedi archebu rhwydwaith newydd ym mis Mehefin leni. Roedd gyda ni bach o gynsyrn fod yr offer ddim yn mynd i gyrraedd cyn diwedd y flwyddyn ariannol ym mis Mawrth. Ond nawr rwy'n falch gallu dweud bod ni'n disgwyl y bydd yr offer i gyd yn cyrraedd cyn ddiwedd mis Mawrth. A wedyn, yn ogystal â hyn, mae gyda ni gwmni White Spider. Maen nhw yn ymgynghoriaeth trydydd parti. Maen nhw wedi cael eu caffael i gefnogi'n tîm ni gyda'r gwaith dylunio, gweithredu a profi'r rhwydwaith cyn bod ni'n trosglwyddo'r gweinyddwyr yn gros. Nhw wnaeth y gwaith pan wnaethon ni roi'r rhwydwaith newydd yn y ganolfan ddata arall llynedd. Sleid nesaf, please. So, tyma bach o wybodaeth fan hyn am y cynllun prosiect. So, mae'r cynllun wedi cael ei greu gan ddefnyddio'r gwersi a ddysgon ni o'r prosiect i symud canolfan ddata un llynedd. So, naeth hwnnw fynd yn dda iawn. A'r bwriad yw i ailadrodd rhan fwyaf o'r gweithgareddau a wedyn gwella ar y lleill. So'r cam cyntaf sydd wedi cael ei wneud nawr yn barod oedd archwilio'r seilwaith sydd gyda ni ar hyn o bryd. A fel ni'n gweud, mae hwnna wedi gorffen nawr, a nawr mae'r tîm yn symud ymlaen i'r gwaith dylunio a wedyn gweithredu a phrofi'r rhwydwaith newydd, unwaith byddwn ni wedi prynu yr ganolfan data newydd. So, rhan mawr arall o'r gwaith paratoi yw ymgysylltu gyda'r gwahanol rhanddeilliad sydd gyda ni, i gael nhw yn barod i symud y systemau, a fel enghraifft allai rhoi fel un o'r cwmnioedd sy'n darparu systemau meddyg teulu. Mae gweinyddwyr nhw yn byw yn ein canolfannau data ni. So, rhan bwysig iawn o hyn yw profi gwitnwch yn systemau ni, fel yn bod ni'n lleihau'r risg o broblemau amser byddwn ni'n symud yr offer. Wedyn mae'r broses o drosglwyddo'r offer, a ni'n amcangyfrif y bydd hwn yn digwydd rhwng mis Medi a mis Tachwedd blwyddyn nesaf. A wedyn y cam olaf wedyn bydd i brofi'r gwitnwch unwaith yn rhagor ar ôl trosglwyddo'r offer, a wneud siŵr bod pethau dal yn gweithio fel byddwn ni'n disgwyl nhw. A bydd peth o hwn yn cael ei wneud o fewn sgôp y prosiect, a bydd y gweddill yn cael ei bigo lan gan mae gyda ni raglen cadernid blynyddoligol. Sleid nesaf, please. So, y camau nesaf sydd gyda ni yw dyfarnu'r contract ar gyfer y ganolfan data newydd, os bydd y bwrdd yn gytuno i wneud hynny heddi. Gweithio gyda cyflenwyr ganolfan data newydd i gytuno ar dyddiadau amser fydd y cyfleuster yn barod. I ni gallu dechrau paratoi ein rhwydwaith ni. A wedyn cyflwyno achos busnes i Lywodraeth Cymru gael yr arian ar gyfer gofynion y prosiect a'r gofynion gweithredol. Hynny yw y costiau i redeg y ddwy ganolfan data. A wedyn, yr rhan ola wedyn yw cadarnhau'r cerrig milltir ar gyfer y prosiect. A wedyn cyfleu'r dyddiadau hynny i'r rhanddeilliad sydd gyda ni both yn fewnol a tu allan i Iechyd a Gofal Digidol Cymru. Diolch yn fawr iawn. Yn hapus i dderbyn unrhyw gwestiynau.
Thank you, Carwyn. David, I can see you've got your hand up.
Thanks, Simon. Thanks, Carwyn, for the briefing. A couple of questions, if I may. This looks similar to the data center move that we did successfully previously. Are there any differences in terms of the timescale we're trying to do this in, or any complexities around the scope, or is it pretty much the same scope, same sort of program plan that we have for this?
It's quite similar, David. So there's a little bit more equipment in this data center than there was in the other data center. Not a lot of difference. The move will be a little different because the way that the procurement has landed means that we are staying within the same building. We're moving to a new data hall, so there'll be slight differences around that. In general, we're looking to do almost the same rinse and repeat of what we did last time around, but we did learn some lessons. So certainly around the network, and once we'd moved the servers, we then were moving pieces of the network afterwards, and we will looking to see if there's a way that we can move that work around a little bit this time around, because one of the things we're fairly keen to do is, as soon as we've moved the equipment, be able to decommission the old facility as quickly as possible, because we will be paying obviously the dual running costs. So that, I think, is probably the main area that we'll be looking to improve. The fact that we're staying within the same building does give us there are a lot more options on the table than there were when you move into a completely new building. You know, we are able to install a lot more network connections if we need them, you know, within the building, because it is just a matter of running some fiber optic cables through the building. instead of, you know, needing to pay a lot of money to Openreach or somebody like that to put circuits in the ground.
Great, thanks, Colin. Supplementary, if I may, Claire has previously highlighted some concern around the risk of digital inflation and the fact that we need to secure the budget for that. Is there any risk of the costs for this going beyond what's government are expecting? So the cost of the energy is the greatest fluctuating thing in the middle of all of this. From a data center perspective, procurement has landed a very good position. You know, we are getting a better data center, lower, you know, better efficiency, you know, lower carbon utilization and all the rest of it, for less than we are currently spending, if assuming that energy costs remain the same. Yeah, and then so the energy cost is the big bit that's different. The cost of the move as well at the moment, you know, we're working up the plans around that. Quite a lot of the costs. Some of the costs are more than last time round because since then new systems have gone in, and typically the third parties will require us to pay them to move their equipment between the data centers. So we have some additional systems that have gone into the data center since last time round. So the 111 system, the Welsh Intensive Care Information System are two that sort of spring to mind. Claire, I don't know if you wanted to say anything else on the finances.
What I would say, David, is that Cowan, together with his financial business partner, who also worked on the previous move, have done a detailed analysis and comparison between where we are now and where we will be post the implementation of this. But as Cowan's already alluded to, there are some costs inevitably now have gone up as a result of inflation, general inflation, and the one that we are keeping a very close eye on is the energy one. So yeah, we're working collectively on that to ensure that we budget and plan correctly.
Thank you, Claire. Alistair and then Marion.
Thank you, Chair. Slightly broader question. We are looking at a range of things on our agenda today and on our other meetings during the year, which individually are extremely sensible things that we do and extremely important things that we do. I think it would be really good that we see how they join up and that they connect to be part of our plan for the year. And I think it's really good that we see the first item in terms of impact assessment on our reports is strategic objective. I feel it's a little general the way we deal with this, and that it would be really good to be able to, as we look at different items on our agenda, to be able to identify that this particular action that we're planning on taking, which may well carry significant budget implications, is, for example, critical, non-critical, is part of our 2022-23 core plan, whether it's maintenance and operational. I feel that we're kind of a bit processy in the way we're just saying, okay, it's part of a broader strategic objective. I get that, but it would be, I think, really important to see how what we do during the year actually adds up to and connects with the objectives and plan that we start out with the year. And equally, to be able to identify within our financial outline that this item that we might be approving or considering is within budget or other aspects of that. I think it's a little general just now. So a slightly broader point, but it's something maybe we can give some consideration to.
Thank you.
Thank you, Alistair. Ruth. Yeah, Ruth.
Thanks, Karen. You touched on it briefly in an answer to David's question, but talk to me about our carbon footprint and what this does for that. I assume if we're within the same building, actually, there's limited stuff we can do to reduce our footprint other than moving into more efficient hardware.
No, that's not the case. So we are moving because within this building, so there are numerous data halls which have been built at different points in time. and so we are moving to a newer hall, one that's just been constructed. So as such, so the main difference between data centers is there's a measure called PUE, power utilization effectiveness. So it compares the amount of power that the data center consumes in its entirety compared to the amount of energy that goes into the servers to do the work. And the rest of it goes on things like lighting and whatever, but the biggest chunk of that is the cooling. So we occupy 2 data halls at the moment, and their PUE are one is around about 1.8 and the other one's about 1.65. So if we're using 100 watts in the server, we're using another 65 or 80 watts to cool it. In the new data center, the new data hall, the PUE is 1.3. So it's significantly less. So I kind of worked it out. I think it's about a 21% reduction in carbon emissions by moving the same equipment into a better cooling facility, essentially. We are putting a new network in as well. That will make a little bit of a difference as well, but nowhere near as much as that first part there.
Thanks, Carwyn. Rowan.
Just really to echo Carwyn's point that with the data center, it's usually the cooling piece that is the controllable way of reducing carbon, and the technology that's used to provide the cooling, and whether you can recover energy for a benefit that's adjacent, which is not very often the case. But Carwyn, I think it's a great plan. You delivered the last one beautifully. You set a high bar. We expect you to meet it again.
Oh, great.
Thanks, Rowan. Rydian, you wanted to come in.
Just a quick thank you, Chair, for the work they did last time and the work that they'll do in the future. The fact that the clinical workforce didn't know it was going on is a testament to the skills of those involved. It is important that we understand that keeping the lights on is the #1 primary objective. It's a 24/7, 365 service. And I'm really grateful for the effort and the extra effort that the teams make, particularly when they're transitioning services.
Thank you, Rydian. Go on, Claire.
Final point for me is we've really focused on addressing our legacy debt in terms of our operational technical base. And we were commenting yesterday, we met as a team yesterday, how much our conversation has moved on from the reliability around our data centers to actually into more of the development space. And that's the backdrop of actually moving on and investing in some of these key areas. This is really probably the final step in that process, because we're now got obviously a real priority of moving to cloud. And I think this will actually enable us to move that conversation on further into how do we use that technology to create value with the digital products it will serve. So for me, this is the final sort of step in the data center journey that has actually dominated our conversations and our actions and activities over a period of time. And that will enable us to then take the next step forward, which is to go to cloud. So I fully support this, and we've worked quite hard behind the scenes to ensure that we do that in the most cost-effective way and minimise the impact on the organisation. So it's a great next step.
Thank you, Claire. And thank you for taking us through the what the next steps are going to be, Carwyn, in a way even I could understand, and echo everyone's comments around the wonderful way the transfer was done previously, and that's setting the bar for you doing it this time.
We have a lot to live up to, and of course the aim is to do the same again with
absolutely
the same level of disruption. You know what I mean? So
get it right first, get it right second. Now we've been asked to note that report. The actual procurement approval will come on to in a moment.
Time, yeah.
So if I then move on to that item, the strategic procurement report, I'll ask Ivan Evans, the Exec Director of Strategy, to introduce it, but I know he's been joined and I can see she's joined us. Welcome, Michelle, who will no doubt take us through the detail, but over to you first, Ivan.
Diolch yn fawr iawn, Simon. Mae'n bleser da fi gyflwyno Michelle ar gyfer y ddwy eitem nesaf, a dweud y gwir. Felly mae hi'n gyflwyno ar caffael strategol, a wedyn yn dilyn hynny bydd na ddiweddariad ar link ar RISP. So, na i drosglwyddo i Ddwylo Dogel, Michelle am yr eitem nesaf.
Thank you, Ivan. Good morning. So there are 3 contracts outlined in the strategic procurement report. So I won't go through all the detail because that is included in the report. I'm just going to call out a few key things as we go through for the information of the board. The first thing, just to be very clear from the perspective of approvals, we've notified all 3 contracts to Welsh Government. So that is under the requirement to notify them of our intention to enter into a contract. We are waiting for a response from Welsh Government at this point. I'm sure they're working on it. Simon, I'm asking for approval from the board, subject to us receiving that confirmation, which obviously we would then notify to you so that we were clear that that was all in place before we action any contract awards. So I'll take these one at a time, as I usually do. So the first is actually a call-off order. So this is under an existing framework that we operate as an organisation. So the framework is with Trustmark. Trustmark are our appointed Microsoft license resellers, and we are calling off some Microsoft services from that agreement. This is actually around software assurance and ensuring that we've got the right licenses in place to support our server environment. So I think to Alistair's point, this is about maintaining services really and ensuring that we can continue to operate our server estate in the way that we need to. And this is a 3-year contract that we're seeking to enter into at a value of about £1.1 million.
Sorry, apologies. You're going to stop and at each one, but that makes sense. People happy to approve that one? With this first one and the last one, it always amazes me in a contract of just over 1.1 million, you get to the 51p. But I'm sure it's very important, that 51p.
Attention to detail.
It's not used in terms of the tender, I was thinking. Thank you. If you want to move on to the next one then, Michelle.
Yes, thank you. So the next one, really helpfully introduced by Carwyn. Actually, this is the Data Centre 2 services that Carwyn was just explaining to the board. We're proposing to enter into a contract. Just by way of context to that, the contractor that we're proposing to award to is a company called CDW. CDW are the prime contractor in this situation. CDW are also the prime contractors for our other data centre facility, but the services themselves are provided through subcontract arrangement by more local companies. So we have got diversity in terms of the way in which those are delivered, and we are putting measures into the agreement to make sure that we've got sufficient provisions in place to reflect the fact that we're actually working with one contractor at the prime across both. We're proposing to award a framework agreement. So the reason that we're doing that is that this enables potentially other health boards or trusts in Wales, if they wish to do so, to call off services from the agreement, so to benefit from the data centre capacity, or indeed for Digital Health and Care Wales to call off services. And as Carwyn explained to us, within this award, there is also a call off provision for our purposes to host our services. And we're proposing that we do that for a 5-year period. So all of the values in the paper, I just wanted to be really clear, are maximum values, as they usually are. We've put a maximum value on the framework, and we've put a maximum value in terms of the DHCW call off. Carwyn explained about the power, which obviously is a little bit tricky at the moment in terms of values, but also our overall strategic plan, which is obviously to reduce our kind of data center capacity and our move to cloud. So we would hope over that period we would see a reduction, and the contract has been structured in such a way that we can reduce the number of racks. So we're starting with 44, that's our core call off to provide the capacity that we need on day one. But the plan is that that would reduce over time, and therefore I would expect the values to come down. But we're putting that in really so that we've got that resilience there should we need it. Again, as I said, Carwyn explained this very well. This is an internal procurement really to maintain services that we provide to the health boards and trusts, and has been overseen by Carwyn and his team. So I'm seeking approval to award that one.
Thank you, Michelle. Any questions or comments? No, it looks like people are happy to approve that. And the final one.
Thank you. So the final one is for checkpoint support. So the checkpoint firewalls as part of our cybersecurity infrastructure, very important to the organisation in terms of the way we protect the services that we're delivering to the health boards and trust. Again, this would be an operational service or maintaining operational services securely.
we're proposing to award to a company called Insight. Again, Insight are a prime contractor. The service itself is delivered by a company called SEP2. So SEP2 are the certified checkpoint partner, really, who deliver with us. We've been working with SEP2 as an organisation for a number of years now, and they've delivered very good services to us, particularly in this area around our firewalls. So this is quite a helpful outcome, I think, from the perspective of the team, that we know that we can rely on them to deliver the level of service and resilience that we need. So again, this is a 3-year contract that we propose would start on the 1st of December, and the maximum value of that for the support that they provide, and potentially there's an option in there for some additional services should we wish to call them off around audit or other services. And I think experience in recent times has shown that we may want to call off some additional cybersecurity support from some of our expert partners. We've built some capacity into the agreement to do that should we wish to do so. So also seeking approval to award that one.
Thank you, Michelle. And again, you have the board's approval on that one. Thank you for that. But obviously you're not going away, Michelle, because you've got a starring role in the next item. So thank you. We move on then to item 5.4, which is around the transfer of a number of digital programs from the NHS Collaborative to ourselves. And I think Helen. Sorry, Ivan, someone's shouting.
Yeah, diolch, Simon. O'n I just...
oh, sorry.
No, mae'n iawn. O'n I just eisiau cymryd y cyfle I ddiolch I Michelle a'r tîm masnachol am y gwaith maen nhw wedi gwneud. Mi fydd y bwrdd yn gyfarwydd gyda'r adroddiadau caffael yma. Maen nhw'n cael eu cyflwyno mewn ffordd sicr, a taclus ac eglur iawn. Tîm weddol fach yw'r tîm masnachol, a wy'n credu bod nhw'n gwneud gwaith ardderchog. A wi hefyd ys y tynnu sylw at bod nhw'n gwneud mwy na just y gwaith caffael, achos mae yna waith rheoli contract, mae yna waith datblygu perthynas gyda'r cyflenwyr, a mae yna lot fawr o waith arall nad yw'r bwrdd yn gweld yn yr un ffordd, a wi jyst yn cymryd y cyfle I ddweud diolch I Michelle ac hefyd i'r tîm sy'n dîm bwysig iawn o fewn y sefydliad.
Absolutely, and I'm sure we'd all endorse that. Apologies, I didn't see you, Ivan. It's the dilemma of looking down and you haven't got the board secretary sitting next to you to kick you on the leg to point out that someone wants to come in. So I'm sure we'd all endorse that that appreciation. Absolutely. And then, as I said, moving on then to the next item, which is going to be introduced by Helen, and I think Michelle is obviously going to be part of the next item as well. Helen, over to you.
Thank you, Chair, and really not a lot from me. This is building on the decision that we made at the extraordinary board meeting last month to accept, if you like, the transfer of these 2 major digital programmes, national major digital programmes, from the NHS Wales Health Collaborative to Digital Health and Care Wales. That was following the decision that these programmes would not transfer as part of the functions of the collaborative that are transferring into the NHS executive. So we promised that we would bring an update to this board meeting in terms of the development of that work, and actually a quick update on where we are with each of those programmes. So, and I'm really grateful to Michelle, who must feel like this is taking over a full-time job at the moment, being part of all of the work that we're doing around the diagnostics agenda. So I'm really grateful for all of the in-depth work that's going on with Michelle and the team across DHCW and across the Health Collaborative and across the suppliers at the moment. But I'll hand over to Michelle. Thank you.
Thank you, Helen. So just a couple of key points again that I wanted to call out from the report. So the first I want to say, I'm really pleased to say, and noting what Helen's just said, we have appointed an interim programme director inside the organisation who I'm now working with very closely and who is leading the transition process for us. So Alison Maguire, who will be familiar to some colleagues, a really good appointment, and I'm really pleased that she's going to be taking this forward. Alison was pivotal in leading a number of programmes in response to COVID, so around contact tracing and the vaccine system. So I think she's more than up to the challenge of helping us now move forward with these programmes. So really pleased that Alison is on board. The transfer process is well underway now, having been accepted by the board. And the 2P consultation with the team in the collaborative is due to complete this week. I've been involved in a number of meetings with the folks who are transferring, and we've had a very positive feedback, I think it would be fair to say, from the team. And I think the director of the collaborative reported the same thing from his perspective. So we're really keen, as we talked about in our October meeting, really keen to welcome that new team to come and join us, and to make them feel very much a part of this organisation. So that is well underway, with a lot of support. Thank you from my people in OD and finance colleagues, and Julie Ash from the corporate team. So we've got a bit of a team stood up, and we are now managing that transfer safely into the organisation. So I want to touch a little bit on Link first. So Link, that's the laboratory system programme. So we've had the team on site in our offices in Cardiff. So that's the whole team. So that's the programme team. That would include folks from our own organisation and the supplier. And I think that's had a real kind of drive toward the progress in that programme. It's been really helpful. We had a catch-up session yesterday, in fact, and I think I could see quite a lot of progress had been made by having the team working and very focused on what needed to be achieved within that period. So that's really good. We've got a new plan that's now being worked on, and we need to really understand that now in terms of the resources and the deliverability of that plan. I do want to be open with the board, though, that there's still quite a high level of concern actually about how deliverable this programme is. So we're not out of the woods yet. There's a lot of work to be done, and we've got a very tight timescale in order to deliver this. So, you know, keen to be open about that really, and we've been clear about that with the supplier and with the team, about the things that we need to do to take that forward. And on that note, actually was really helpful. We joined the Chief Exec's meeting with Helen earlier in the week to make sure that the Health Board and Trust Chief Execs were fully up to speed in terms of where the programme is, and that they were cited in terms of the way forward that we were now proposing. So that was a joint update, which I think was helpful with the collaborative director. The programme is still with the collaborative at the moment, so it transfers on the 1st of January, but also with the SRO, who's been very helpful, who's also relatively new on board and is very keen to look at the governance and ensure we've got the right mechanisms in place to move it forward. So we updated to chief executives, and I'm sure Helen will be keeping colleagues in the loop, so that everyone is clear on how this is moving forward. And the other thing I just want to mention then, radiology. So radiology is the other main programme that will transfer, so RISP, which is basically the radiology information system and the PACS. That is a procurement that is underway at the moment, so it's sitting some way behind in terms of the timeline for Link. So we're just getting toward the end of the procurement, so the board should expect to hear updates on that more formally through this mechanism. But I've also asked Alison to lift the lid on that one a bit and really get an understanding of where that one is in terms of status and planning, and to work closely with the team, and she's already started to do that. And I think we need to ensure, obviously, that we take some of the lessons from Link, and we make sure that we've you know, taken those on board, and then we've got a robust plan to deliver the radiology programme going forward as well. So that one we've got a bit more work to do on, and we've to be honest focused most of our attention on Link at the moment because of its status, but we are also very much getting into RISP, and would expect to get a robust plan around that as we move forward. So that was my update. Really happy to take any questions from the board.
Thank you, Michelle. Just I've got one. I'll come back then. The hands were slow going up, but now they're going up. Like Rowan, and then Marion, and then David.
Marion, sorry, Michelle, it's just an observation, I think, more than anything. We'll touch on in 6.4 the corporate risk trend analysis that Chris Darling produced for the DG&S committee. You know, we have some projects or programs that we are operating where the amount of risk we're carrying is going to be much greater than the board's appetite for risk. And it's one of the ways that we make that explicit. And you know, there are a lot of pieces of this to juggle. So I think it's very important that the team and the organization gets the support it needs to be successful. We need this to be successful. And that means making sure that the budget and the talent is around the table. And I know everyone's going to have this top of mind, but I think it's just worth saying it in those terms, Michelle, that you know, it's recognised by the board that there is considerable challenge around these two programmes. So thank you.
Absolutely, absolutely. Marion.
Diolch Cadeirydd, ag sylw falle sgynna I yn fwy na cwestiwn a deud y gwir. Wrth gwrs, dyn ni gyd fel bwrdd yn gwbl gefnogol I drosglwyddo'r rhaglen link y mae yna fwy o gynsern amdani I iechyd a gofal digidol Cymru. Ac wrth gwrs, mae o yn gam gwbl resymegol ar sawl cyfri. Ond o'n i'n falch bod Michelle wedi cyfeirio at yr lefel o gynsern sy'n o ran gweithredu sawl agwedd o'r rhaglen yma yn llwyddiannus. A dwi'n meddwl bod yn bwysig bod ni'n onest yn cydnabod hynny ar hyd y daith. I ni'n gobeithio, fel mae rwan wedi dweud, bydd hwn yn raglen llwyddiannus yn y pen draw, ond mae yna risgau mawr a mae'r concerns yn parhau. A dwi'n meddwl bod yn bwysig iawn bod ni'n ddim yn anghofio'r heini yn y narratif pan I ni'n cyflwyno diweddariadau ac adroddiadau am yr rhaglen yma wrth wahanol elfennau ac rhanddeiliad felly. Dwi'n falch o glywed bod ni wedi penodi cyfarwyddwr cynorthwyol cyfathrebu a dwi'n siŵr bydd y person yna yn gallu helpu ni hefyd sicrhau bod y negeseuon yma yn glir fel I ni'n symud ymlaen. Diolch.
Thank you, Marion. And David.
Thanks, Simon. Thanks, Michelle, for the update. Really pleased to see that we've taken the opportunity to baseline the status of the programmes as they're transferring with the wider health board. I think that was an essential step. My question really is around ongoing updates on this programme, given the risks that you've identified. Can you just sort of outline when the board and the DG&S committee would likely get further updates on this programme as we lead up to the official transfer, which I think is 1st of January, and then subsequently to that?
Yes, really good point, David. I'm happy to provide updates, but we just need to look at that offline and think about what's the best way to do that. We've also made the same commitment to the chief executive through the collaborative executive group. So Helen, I guess we could look at, clearly we need to keep our board up to speed in the same way that we're briefing the health boards and trusts. So
yeah, and the board will recall that we're, and I think it's just about to kick off, isn't it, Chris? A rolling program of program updates for the board, so that everyone can be at the same speed. And clearly, the link RISP programs need to be fitted in that with the regularity that they need, and that might be more regular than some of the others at the moment, David, wouldn't it? Just in terms of level of risk. Helen, you want to come in?
Yeah, I just, and in terms of in the interim period between board meetings, I mean, clearly this is a standing agenda item weekly on our exec team discussions. So what I will continue to update yourself, Simon, and the IMs in our kind of informal weekly briefing sessions as well, just to ensure that the same kind of everybody is briefed in the same way as we progress through the transfer and the you know, the improvements hopefully we'll see through the programme and the programme performance.
And sorry, Michelle, go on, far away.
Sorry, Simon, I was just going to pick up on a couple of the points as well. So, because David helpfully mentions about Digital Governance and Safety Committee, obviously we report programme progress through there and the conversation about risks. So very mindful at the moment, Link and RISP have not been programmes being run by Digital Health and Care Wales. So we've had a slightly arm's length relationship with them. And Chris and I have discussed this. As soon as the programmes transfer from January, I would expect the profile of those programmes to change within this organisation, because they will be firmly our programmes, so things like the risk register and the way we report progress through our committees, I would expect to change because they'll become more firmly into the DHCW governance arrangements properly. So we are looking at doing that already, but thank you.
Thank you, Michelle. And something occurred to me while you were speaking, I think and perhaps you, myself and Helen can discuss when the appropriate time is. I think we ought to take something into the chair's peer group as well. because I know in the past, over the past 12 months, that it's been an issue that's been raised within chairs, and I'm sure they're talking to their chief executives, but actually getting all the chairs together to get to hear the same thing, and would be helpful. So perhaps we can have a conversation when that might be appropriate, when the best time to do that would be next year. Thank you all very much. We're asked to note that report, and we've obviously approved the transfer, so we're noting the update from Michelle, which I'm sure people are happy to do. Thank you. And if you recall, I said right at the beginning that I was going to bring one item forwards to enable David to present any highlights from the written report you've seen there of the latest independent member network meetings, which David chairs. David, over to you.
Thanks, Simon. Yes, we had our fourth meeting back in October. We had 4 substantive items on the agenda, which are covered in the papers for the board meeting. There's 2 things I'd really like to pull out, which were, we had a presentation on the digital services for patients and public, which was very well received. The pilot is about to go live. There was some discussion about both of the GP systems that we support being part of the pilot, and we confirmed that that was the case. There was a little bit of concern raised about the level of engagement across the GP surgeries that are involved in supporting both the pilot and the wider rollout of this. A lot of discussion, which the team presenting took on board. So I think they've got some good feedback from the IM network. The other thing I wanted to pull out was we had a good briefing from the Cyber Resilience Unit. And that sparked quite a bit of discussion around the assessment that had been carried out using the cyber assessment framework, and the fact that there was a little bit of variation across the health boards and ourselves in terms of compliance with the framework. Also touched a little bit on the recent incidents around the 111 service, and there was a feeling amongst the independent members that maybe the independent members of the health authority should be doing a little bit more to raise awareness of cyber at the board levels of the health boards. And to that end, we have basically allocated a chunk of time at the next network meeting, which will be in January, to discuss how we can, between us, help facilitate and support that.
Thank you, David. Any questions or comments? I think anything that we can do through that network that keeps cybersecurity right at the top of the agenda across the system is helpful and welcomed. Rowan and then Helen.
Simon, just to say 2 things really. One, David chairs these meetings phenomenally well, and it's a delight to participate. I think the second thing I would say is it's a really pleasing example of the development of the organisation over the last coming up for 2 years now, I think, people, in terms of us finding our feet and being able to lean out into the wider NHS system and create top to top, peer to peer type engagement opportunities. So yeah, just hopefully this will continue, because I think at the moment it's working well and bringing value across the NHS in Wales.
Thank you, Rowan. And Helen.
Thank you. Yeah, thank you, David. I just wanted to kind of make you aware of kind of the unsolicited feedback on the IM network from a couple of the IMs, to say they're really enjoying the updates and the information that they're getting, and actually it's having an impact and changing the conversations around the board. And I think Simon, reflecting on yesterday's chairs and chief exec meeting with the minister, at least 2 of the health board chairs picked up on cyber as part of that. So I think there is definitely kind of the amount of briefing that is going on through the IM network is certainly starting to filter into those broader board discussions. So I think it's been really, really useful. So yeah, and thank you, David, for clearly all of the effort and energy that goes into chairing it.
Absolutely. I'm sure we'd all
very pleased to know that there's some positive feedback, that we're making a little bit of an impact at the board level.
Yeah, absolutely. And echo the appreciation of the work you put and the effort you put into to chairing that group, David. Now, I probably ought to say nice things about Bill Gates to ensure that my system doesn't crashes in the lunch break. So we're going to take a lunch break now. It's 10 past, so I suggest we come back at, what's half an hour? 22, isn't it? So at 12:40, just if you could get back here a few moments before that, that would be great. If please again remember, turn your camera and your video off, your sound off, and we'll see you just a few moments before 22. Have a good lunch. Can you hear me? Brilliant. It's absolutely chucking it down here. Is it with you? Yeah. Sorry.
Yeah, hammering it down.
Yeah.
Just rain, or is it the hailstones as well?
Just rain at the moment.
Load of hailstones yesterday.
Mm. Okay. Give it a couple of moments for people to turn their cameras on. Here we come. We definitely need Ivan. Oh, there we are. Okay, that's Michelle back. I think that is everyone back. Welcome back, Panandar. If we move then into part 6 of the agenda, the governance, risk, performance and assurance part of the agenda, and 6.1, I'll ask Ivan to introduce the integrated organisational performance report. Ivan, over to you.
Diolch yn fawr iawn, Simon. Mae'r adroddiad yn un sydd yn gyfarwydd i aelodau, ond mae gyda ni rhai aelodau newydd ar y ddwy ochr o'r bwrdd, felly wi jyst eisiau rhoi crynodeb cyflym cyn cyflwyno a cymryd bod pawb wedi darllen y papurau a'r nodiadau, felly dwi'n mynd i fynd trwy rheina a'i adrodd nhw. Ni newydd pasio hanner ffordd trwy'r flwyddyn, felly wi jyst yn mynd i edrych yn ôl tipyn bach ar y 6 mis cyntaf hefyd, a tynnu rhai pethau allan. Cyn i fi wneud hynny, fel wy'n gwneud yn reolaidd, wi eisiau diolch i tîmoedd ar draws y sefydliad am eu cyfraniad i'r adroddiad. Ni'n gweithio'n galed iawn i gadw'r adroddiad yn mor gryno a phosib. Mae fe tua 30 tudalen. Ni'n ceisio gwasgu cymaint o wybodaeth a fedrwn ni mewn i hwnnw mewn ffordd glir sydd yn cyfathrebu yn eglur lle ydyn ni o ran perfformiad. Ond tu cefn i hynny, dan yr wyneb, mae cryn dipyn o waith yn mynd i gyfrannu o wybodaeth sydd yn mynd mewn i'r adroddiad yma. Yn gynt yn y cyfarfod, mi nath Alistair sôn am sut ni'n dod â popeth at ei gilydd mwyn gweld beth sydd yn gwbl allweddol, beth yw sut mae pethau'n integreiddio, sut mae pethau'n perthyn i'w gilydd. Wy'n credu bod y broses IMTP yn rhan bwysig iawn o hynny. Mi nath y bwrdd drafod yr IMTP a sut ni'n mynd o gwmpas y broses hynny yn y cyfarfod diwethaf. Mi fyddwn ni'n disgwyl edrych ar drafft o'r IMTP yn y cyfarfod nesaf am mis Ionawr. Dyna yw'n prif leunoriaeth. Ond cymaint â phosib i ni yn ceisio sicrhau bod yr adroddiad perfformiad yn adlewyrchu'r IMTP a dyna pam welwch chi yr un strwythur yn rhannau ohono fe ynglyn â'n gweledigaeth ni a'n cenhadaeth ni fel sefydliad, yna i sôn am hynny mewn eiliad. Dwi eisiau sôn jyst tipyn bach ynglyn â uchafbwyntau'r flwyddyn. A wy'n sôn am hynny achos fel nath Rhydian sôn yn gynharach ynglyn â symud o un canolfan ddata i'r llall yn ystod y cyflwyniad gan Carwyn. Un o'r pethau gorau am llynedd oedd bod staff clinigol ddim wedi sylwi bod e wedi digwydd o gwbl. A mae yna lawer sydd yn digwydd, mae tîmoedd ar draws y sefydliad yn gwneud ar ei pennau hunain a yn gweithio'n agos gyda'n rhanddeiliad ni ar draws yr NHS. Lle mae popeth yn mynd yn llyfn ac o ganlyniad i hynny, dyw e ddim yn cael ei godi yn uwch i'r bwrdd fel risg neu fel rhywbeth sydd angen sylw ychwanegol. A wi jyst eisiau sôn am rhai o'r pethau hynny, achos mae wedi bod yn 6 mis prysur, a mae yna nifer o bethau sylweddol iawn wedi cael eu cyflawni. A maen nhw'n teimlo fel bod nhw'n amser hir iawn yn ôl, ond dyn nhw ddim mor hir a hynny. Felly, yn gyntaf, mynd yn fyw gyda'r system gweinyddu cleifion WPAS yn rhan mawr o beth sy'n gydwalder yn y gogledd. Lot fawr o gynllunio yn broses ath yn llyfn o ran hynny. Mae'r system gofal cymunedol, WCCIS, yn ystod mis Awst, wedi mynd yn fyw i 6,000 o ddefnyddwyr newydd yn Aneurin Bevan. Ato'n gam pwysig iawn ynglyn â siwrne WCCIS. Mae'r app fel rhan o'r rhaglen DSPP nawr yn y broses beta preifat. Mae yna fil o ddefnyddwyr yn gweithio trwy'r app yn rhoi adborth manwl, a mae hynna'n broses sydd yn mynd yn llyfn ac yn rhoi dealltwriaeth defnyddiol iawn i ni o sut mae defnyddwyr yn ymateb a defnyddio yr app hynny. Byddwch chi'n gwybod o'r cyfarfod eithriadol diweddar ynglyn â'r y caffael fframwaith ar gyfer trawsnewid meddyginiaeth ddigidol, fframwaith sydd werth hyd at 100 miliwn Mae byrddau iechyd sydd bydd yn pwrcasu trwy hwnnw, ond hwnna'n gam pwysig iawn ymlaen, a hefyd wrth gwrs yr holl waith mae Michelle wedi newydd adrodd o ran link a RISP a'r gwaith i ni wedi bod yn gwneud gyda'r collaborative a gyda'r tîmoedd hynny dros fisoedd. Hynny yw, mae'r broses o drosglwyddo y gwaith hynny i DHCW yn benllanw ar y gwaith sydd wedi digwydd ers yn gynnar yn yr haf, gen ni wedi bod yn gwneud crynllipyn fyna. A wedyn, yn y flwyddyn hon, just y bod, y contract Office 365 newydd ar ganolfan rhagoriaeth mis Ebrill, teimlo yn hyrach yn ôl na hynny. Rhan gam pwysig ymlaen ynglyn â gweithredu fel un system integredig ar draws Cymru, a wedyn dod â ni reit lan yn ddiweddar beth oedd Helen yn sôn am yn gynt ynglyn â'r cofnod iechyd digidol yn Felindre, bythefnos yn ôl. Hwna eto yn gam pwysig iawn. Felly mae yna lot fawr yn digwydd, a mae rhai o'r pethau hynny yn newydd, yn ychwanegol. Mae'r gwaith y link a'r RISP er enghraifft ddim wedi gynllunio mewn yn llawn, a mae tîmoedd yn gorfod ymateb i'r pwysau hynny yn ystod y blwyddyn a'r ceisiadau ni'n cael oddi wrth y Llywodraeth neu oddi wrth rhanddeiliad eraill trwy'r amser er mwyn ymestyn yr adnoddau fel bod ni'n gallu cyflawni hynny. Felly, o'n i jyst eisiau sôn am hwnnw oherwydd bod ni'n hanner ffordd trwy'r flwyddyn. A wedyn, wi eisiau sôn just ambell i beth, a byddai'n gwahodd Carwyn a Sarah Jane mewn nes ymlaen, jyst i sôn am dwy agwedd yn benodol yn yr adroddiad integredig, a wedyn byddwn ni gyd yn gallu ymateb unrhyw gwestiynau penodol sydd gyda aelodau annibynnol. Yn gyntaf, o'n i jyst eisiau tynnu'r sylw at y ffaith bod yr adroddiad yn bennaf yn adroddiad ar ein perfformiad mewnol ni fel sefydliad, ond mae yna elfennau o adrodd ar raglenni cenedlaethol fel WEDS neu WCCIS, lle mae penderfyniadau a rheoli yn cael ei gwneud ar lefel leol yn aml, a hefyd ar y system yn ei gyfanrwydd. Felly, byddwn ni'n adrodd ar ddigwyddiadau cynnal gwasanaeth ar lefel genedlaethol, ond ambell waith mae'r problemau gyda'r rheina yn gyfuniad o faterion cenedlaethol neu lleol, a bydd Carwyn yn sôn tipyn bach mwy am hynny. A mi welwch chi ar y dashboard un o'r ardaloedd sydd yn amber. Sydd yn amber eto yw y cyfarfodydd Service Level Agreement, y cytundebau lefel gwasanaeth. Yn amlwg, mae rhaid i ni a'r rhandeiliad gytuno i'r cyfarfod hynny. Byddwch chi gyd yn ymwybodol faint o bwysau sydd i gael ar draws y system iechyd i gyd ar hyn o bryd. A i ni wedi cael un anodd i gael hyn am mewn i'r dyddiadur. Mae nifer ohonyn nhw wedi cael ei gohirio yn aml, neu bron bob tro a dweud y gwir, oherwydd y pwysau sydd gyda'r gwasanaeth darparu system iechyd, achos mae yna bwysau aruthrol allan yn y bwrddau iechyd er enghraifft, a llefydd tebyg. A wedyn y rhan olaf, a byddai'n trosglwyddo i Carwyn ac wedyn i SJ ar ôl hyn. O'n i jyst eisiau tynnu sylw at y rhan, mwy na lai y rhan gyntaf o'r adroddiad, lle ni'n gosod allan y 5 cenhadaeth sydd gyda ni, so y 5 missions, felly yn gweledigaeth ni, 5 cenhadaeth, 12 portfolio gweithredu a 6 amcan sefydliadol. Mae'r rhain ar un peth a beth sydd yn yr IMTP, felly y syniad yw bod y sgerbwd hwnnw, fedrwch chi weld yn yr IMTP, a fedrwch chi weld yn dod trwy yn yr IOPR. A mae hwnna'n rhan o'r broses o ddatblygu'r IMTP eleni, fel bod ni'n gwneud hynny yn fwy clir ac yn fwy amlwg, a felly yn haws i wneud beth oedd Alistair yn sôn am, sef edrych yn ôl ar sut ni'n perfformio yn erbyn y ffordd mae'r holl beth yma'n gorgyffwrdd. Mae yna 2 beth coch yn y tudalennau sydd yn dilyn. A wi jyst eisiau tynnu sylw at treini a dweud maen nhw'n goch oherwydd bod ni ddim wedi bwrw'r amserlen, nid oherwydd bod y rhaglen yn risg coch. Felly, er enghraifft, yn y maes sydd, well, actually, maes Sam Hall ar y foment, o dan WCCIS, mae yna, beth yw Future Roadmap yn Gymraeg, mae yna map hewl y dyfodol. Mae'r gwaith hynny yn mynd yn ei flaen, o'n i wedi rhagweld, bydden ni wedi gorffen y gwaith hynny erbyn diwedd mis Medi, hynny yw diwedd chwarter 2. Mae'r bwrdd rhaglen WCCIS wedi bod yn awyddus i weithio am gyfnod hirach gyda rhanddeiliad, mwyn sicrhau bod pawb yn deall ble ni'n mynd, a bod pawb yn gefnogol i le ni'n mynd, a felly wedi cymryd y penderfyniad i ymestyn y gwaith hynny mewn i chwarter 3. O ganlyniad, mae hwnna'n dod lan yn goch, yn yr adroddiad, achos adroddiad yn erbyn lle o'n i wedi rhaglennu a byddwn ni wedi cyrraedd y diwedd. Dydy hynna ddim yn meddwl nad oes gwaith yn digwydd, dydy hynna ddim yn meddwl bod y rhaglen yn fregus a bod y rhaglen yn ei gyfanrwydd yn goch, dim ond bod yr un pwynt hwnnw yn goch. Felly o'n i jyst eisiau amlygu hynny. Felly, na i drosglwyddo nawr i Carwyn jyst i sôn yn gryno iawn, dwi'n meddwl, ynglyn â rhai o'r digwyddiadau cynnal gwasanaeth, a wedyn gwahodd Sarah Jane jyst i weid rhywbeth ynglyn â gweithlu a datblygu sefydliadol, a wedyn croesawu cwestiynau oddi wrth yr aelodau ar beth sydd yn yr adroddiad.
Diolch Ifan. Felly na i ddechrau, mae'r perfformiad yn parhau'n gryf ar gyfer rheoli digwyddiadau a cheisiadau gwasanaeth. Mae'r ystadegau'r desg gwasanaeth i gyd yn dda ar wahân i'r call abandon rate. Mae hwn dros y target, mae fe'n 7.1 ar hyn o bryd. Mae hyn yn gynyniad i nifer o alwadau ychwanegol ynglŷd â throsiant staff, gwyliau blynyddol a salwch ac yn y blaen. Wedi dweud hyn, dyw e'n system ffôn bresennol ni ddim yn mesur y galwadau sy'n cael ei gadael mewn ffordd dda iawn. Er enghraifft, os bydd rhywun yn rhoi'r ffôn i lawr ar ôl gwrando ar neges sydd wedi cael ei recordio o flaen llaw, er enghraifft neges sy'n gweud bod ni'n ymwybodol bod yna broblem gyda un o'n systemau ni. Wedyn mae hwn yn cael ei gyfri fel galwad sydd wedi cael ei adael. Sach bod y galwr ddim wedi bod yn aros mewn ciw o gwbl. I ni yn y broses o gaffael system ganolfan gyswllt newydd, un fydd yn rhedeg o'r cwmwl a gweithio gyda Microsoft Teams. A bydd hwn yn rhoi metrigau mwy defnyddiol. Yn y cyfamser, ni wedi ychwanegu metric cyflymder ateb cyfartalog sydd yn ein barn ni yn rhoi gwell syniad o'r profiad yma'r defnyddwyr yn ei gael pan yn ddefnyddio'r ddesg gwasanaeth pan maen nhw'n ffonio'r ddesg gwasanaeth. A wedyn, mae 6 allan o'r 7 o'r digwyddiadau mawr, neu'r digwyddiadau IT mawr, gyda Bwrdd. Mae Bwrdd yn feddalwedd ni'n darparu, ond mae'n cael ei redeg ar weinyddion yn y byrdde iechyd lleol. A'r sefydliadau hynny sy'n gwneud rhan fwyaf o'r gwaith cynnal a chadw a'r gwaith cymorth, ac mae'n tîm ni yn cymryd rhan i ddatrys problemau mwy cymhleth. Does dim un mater sylfaenol yn achosi'r problemau. Roedd rhai oherwydd problemau gyda gweinydd gwe, rhai oherwydd problemau gyda gweinydd cronfa ddata, rhai oherwydd problemau rhwydwaith, a 2 yng Nghaerdydd ar Fro sy'n ganlyniad i'r ffaith bod nhw'n rhedeg fersiwn hŷn o Bwrdd, ac mae'r problemau wedi datrys mewn fersiynau mwy newydd. So fersiwn 2.4 neu mwy newydd. A mae pob un o'r byrdau eraill yn rhedeg fersiwn 2.4, ac mae'n tîm ni eisoes yn gweithio ar fersiwn 2.5. So bydd angen rhywfaint o waith addasu arbennig ar gyfer fersiwn 2.4 ar gyfer Caerdydd ar Fro, a mae'r tîm yn archwilio i ba adnoddau fydd angen yno ni i wneud y gwaith yma. A hefyd jyst i bwyntio allan, roedd yr un digwyddiad a dorrodd y metric sydd gyda ni o drwsio o fewn 4 awr yn ymwneud â phroblemau rhwydwaith lleol yn un o safleoedd Beti Cadwaladr, hynny yw ysbyty Glan Clwyd. Na gyd oedd y fi wedi, diolch.
Is Sarah Jane coming in now?
Thank you. Yes, I'm just going to speak very quickly just about the ongoing recruitment challenges and where we are, just following the mid-year financial position. So just some figures really to sort of whet our appetite. 175 vacancies that have been filled this year to date. So there are a number of new people joining the organisation and some people moving on lateral and promotion moves within the organisation to support our grow your own commitments as part of the strategy. We've got 75 people over and above that are due to start with the organisation as brand new people joining the organisation in the next 3 months, and 82 more that we've got various recruitment activities to support them joining us, hopefully by the end of the financial year. So they're either going through the job description, or we're working through the selection process, going through a recruitment activity or interviewing, etc., but they haven't been offered yet. So we're looking by the end of the financial year, hopefully, to have brought in sort of about 230 extra people, as well as freeing up a number of different vacancies for people to move into as part of their own career development. just to provide some assurance to the board, there's a number of innovative assessment centres and recruitment activities and so forth with graduates, and a wide range of new talent coming into the organisation that we've just ramped up really in the last 6 months to hopefully explore new markets and encourage new people to join the organisation. And as we heard earlier, being the best place to work in IT, we would definitely be using that in our branding and our recruitment materials and so forth. And actually, joking aside, I think, that sort of thing will absolutely put us, even more on the map than we already are. So it's just going to be really quite an exciting time, continuing to work really closely with the education sector and across the digital networks and so forth, using our sort of relationships and our network contacts and other ways to try to broaden out, bringing in new people into the organisation, new talent. And I think just finally to say, obviously with the digital workforce review and a number of other things that are moving forward, that's going to give us some even further opportunities to develop career pathways, different frameworks, new ways of thinking how we're going to model certain careers and how we're going to work that across our own organisation, but also nationally across that wider family across the NHS. So lots to go after, ongoing challenges as we all know and are well rehearsed, and I won't go into that again in terms of it's a very competitive market, and we have to stand out as an employer of choice, and looking at our employee values proposition. Development's a big one in that space for us, and being a great place to work, I think is really going to be quite encouraging. And I think we've heard different people saying that, people that are coming into the working environment are looking for perhaps different ways that they want to work and how they want to work and so forth. So we're just making sure that what we've got on offer is absolutely going to be, positive and encouraging to the diverse workforce, really, so we can have a look at different people, different skill sets, different parts of their career, different age groups and so forth, so that we can really hopefully get a really fantastic working environment long term for really talented people in the digital space. So hopefully that was an interesting quick snapshot of where we are in that issue in terms of recruitment, which I know has been an ongoing risk for the organisation for quite some time.
Thank you, Sarah Jane. Thank you, Carwyn and Ivan. Can I just pick up a couple of things with you, Sarah Jane? Because bringing in that number of people in that shorter time, I mean, it's a horrible phrase, this, but onboarding is quite a time-consuming exercise for managers and other team members. Is that manageable in a sense, or is that potentially, bringing this number of people in, new people in, having an impact on those people who have to support their induction, support them getting up to speed?
Yeah, there's a range of things, really. I think in terms of what everyone needs to do that is a manager, there is a percentage of time being a manager that you will need to support staff with development, onboarding, induction, appraisals, and so forth. So that should be built into, the business as usual work, really, because that's what you need to do as a manager. But you're absolutely right. Yes, it is. I mean, what we've tried to do is we've done lots of things like assessment centres, virtual and in person, and that's taken out sort of, 50 people coming for one job, and then going through a sort of an interview of 10 people and just getting the one person, because as you can understand, the amount of activity and work behind the scenes for getting one person in is huge. So again, we've tried to work at minimising impact of people having to be away from the workplace and so forth. But in essence, we've also had lots of support as well, coming to assessment centres with us and talking about, digital careers and so forth. And that's been really helpful for people coming to talk about, what their ideas and what their, excitement is about perhaps joining the organisation, to talk to other people in that sort of digital specialism, which has been really helpful.
Thank you, Sarah Jane. Thank you. Alistair and then Marion.
Thank you, Chair, and thanks, Ivan and Sarah Jane, for the run through of this. There's a lot of information. It's very detailed in some places, and it's I think quite navigable, which is always helpful. Just a couple of thoughts, and just following on from Simon's last question. I was going to just ask, the aspect that we've described in terms of onboarding is an organizational look at the individual, but I do wonder, are we also making space for the impressions that people have coming into the organization from the outside and capturing those early impressions, Sarah Jane, but also making space for innovation from people coming in. So not so much about the organization impressing its culture on the individuals, but actually trying to extract the benefit of new people coming in and potentially saying, well, there are better ways of doing this, or they're making space for that. The other thought was in terms of the just for the avoidance of any sense at all that we mark our own homework, I wonder, can we strengthen, and this might be one, Ivan, for the full year, and it may be something that you already have in plan, as opposed to for the half year, but strengthen the assessment of our key stakeholders and indeed of our employees in ourselves and the way that we operate, as opposed to metrics that we have of our employees, just to try and make sure we've got a balance between how we assess our own performance and how key stakeholders, employees would assess ours. So just those 2 points. Thanks, Chair.
Do you want to pick up on those points now before I come on to Marion?
I can pick up on a couple of things. I think in terms of, there's a couple of things really. We're doing quite a lot of work at the moment on recruitment branding. So I think in terms of encouraging people to understand a little bit more about our organisation, we did some filming yesterday in the office. So we were all in the boardroom. A number of different members of staff volunteered, and we hopefully shot a diverse workforce so that we had a filming crew in, which was really exciting. So we're doing some really good work on recruitment and branding. So that digitally, we've got a really good footprint in that space. I think in terms of people all coming into the organisation, we've got both local and corporate induction. So the corporate induction is great because you make friends and you get to know people from different different areas of the workplace. And we've also introduced a new buddying arrangement where the induction group remain friends and have informal catch-ups as well as a bit of a support network, but a friendship group. And indeed the local inductions, it's very much about the manager, talking to the new member of staff, but also making sure there is space, as you rightly say, Alistair, to encourage people to say, have you thought about this, or we've just done this, and so forth. And I think we are an open, transparent organisation. We are a listening organisation, a learning organisation, and we are really encouraging people to put ideas forward and look at new ways of working, and not just thinking it's got to be one way or it's the highway. So I think there's a really good ethos in that space, and certainly the feedback I've had from a number of new joiners have said they've really found it very welcoming. They've found that people are interested in their ideas, are listening, and also taking things on board. So I think that's been a really positive space, and lots of positive feedback in that regard. So hopefully that will provide a little bit of assurance for you, Alistair.
And just on Alistair's point about not falling into the trap of marking your own homework, and in terms of staff, I know we regularly do this, but when's the next staff the full-blown staff survey scheduled for?
Yeah, I think it's fairly imminent, really. But we also, during the course of the year, what we do is what's called pulse surveys. Yeah. So with the trade union representatives, we have a look at what areas we think might be hot spots, or it may be after a big change in an area, we think, well, let's have a temperature check of that area after a period of time. It might be after introducing a new policy like hybrid working or an appraisal policy or something. So we do various different pulse checks during the year, which I think sometimes are quite valuable, because we can then determine the bespoke questions to ask for our organisation, and the staff survey is more prescriptive in terms of what questions it asks. So I think sometimes the pulse surveys, for me personally, I think are really, really helpful, because we can ask sort of quite stretching questions and really get a temperature check of that in real time, and then obviously make some changes or adaptations if there's anything that needs some development and support around it.
With your forbearance, Marion, does Ivan and Helen, do you want to come in on this point before? Yeah, probably. I thought Ivan and then Helen. And sorry, Marion, I'll come back to you then.
Thanks, Simon. I'm going to be innovative. I'm going to speak in English in a board meeting, because I can see Marion and Karen lined up, so I'll have to watch. on the next questions. We're still quite a small organisation, and we're still working, very closely together. More than half of the whole organisation dials in to Helen's regular monthly call. More than 500 people online at one, which is amazing. And I'm sure we're all running, directorate and division away days. I attend programme away days for the directorates that are in my area. That gives us a really good feel for where the organisation is as a whole, and it lines up with our, come together in person with purpose sort of agenda that we set out in the summer. Alistair, if it's okay, we'll take away how we can translate that into something that is more reportable. I want to give you the assurance that as an exec team, we're very, very conscious of that, and we're taking the sort of temperature of the organisation and the feel all the time. We've got a new head of engagement who's just started. She's reviewing and working up the stakeholder engagement strategy and stakeholder engagement plan, and we take feedback from that, and we take it from digital directors and from other engagement through individual programs and at an organisation level. But I'm not sure how written down it is and how suitable, the extent to which we can translate that to something which is reported back. So we'll take that away and we'll think about how we can do that in a way which develops on what we have at the minute, which is quotes from the service desk and quotations that we're pulling out. See if we can do it in a more structured kind of fashion for the board.
Okay, thank you, Helen.
Yeah, thank you. And I guess really building on the employee feedback, as you say, Simon, we do regular staff surveys, and there's the annual NHS staff survey. I think that perhaps what we'll do is think about how we incorporate that in a timely way into the performance reports, and which of the key metrics, I suppose, as a board, they're the ones that we'd want to see in the performance report. We spend a lot of time on that as an exec team when we get those results. I think just to, I guess, reassure you, I think one of the ones that stood out for me was, and we had quite a good take up from the survey from our staff. 85% of the staff last time they were surveyed said that they were proud to work for the organisation. So it's those sort of metrics, and we don't just look at the good ones. Actually, we'll drill down even into the small kind of numbers that we get there, where there are areas where we think there is learning for us as an organisation. But I think that's something that perhaps we need to look at surfacing perhaps more for the wider board, and we'll take that away.
Thank you, Helen. Okay, Marion, apologies for the delay.
Dim problem, diolch yn fawr. Diolch Ifan ag Carwyn a Sarah Jane hefyd am eich cyflwyniadau. Dwi'n meddwl beth ni wedi weld y pnawn yma ydy bod na gynnydd calonogol iawn wedi bod yn ystod 6 mis y flwyddyn. A dwi'n meddwl bod yn briodol bod ni fel bwrdd yn cydnabod hynny ac yn falch iawn o weld y cynnydd yna. I ryw raddau wyt ti wedi ateb, Ifan, y cwestiwn o'n i'n bwriadu godi, ond dwi am fynd ar ei ôl o beth bynnag, sef WCCIS. A diolch i ti am grisialu beth ydy ystyr y lliw coch. A mae hwnna'n help mawr. Ond o'n i'n awyddus i wybod chydig yn fwy ynglyn â pam bod angen yr estyniad yna o ran cyfnod ymgysylltu efo'r rhanddeiliad. Ac os dwi wedi dall yn iawn, ydy'r corff o rhanddeiliad yma yn cynnwys pob bwrdd iechyd, a fydd maes o law yn cael y system yma. Ac yn i'w gofio bod y system yma wedi bod ar y gweill o be dwi'n gofio, 7-8 mlynedd bosib erbyn hyn, yn i'w be di dy deimlad di, a falle dwi'n eisiau rhoi chdi ar y spot, ond faint mwy fydden ni'n gorfod disgwyl i weld y cyfnod ymgysylltu yma'n dod i ben, a bod pawb yn hapus efo'r llwybr i ni'n gymryd?
Wel, i ateb ar ail ran yn gyntaf, ddim yn hir a ni'n disgwyl gweld canlyniad y gwaith hynny cyn Nadolig yn ystod chwarter 3. Y rheswm dros ymestyn, mae dau ddarn o waith sydd yn gysylltiedig. Un yw'r adolygiad strategol, a mae cwblhawyd y gwaith hynny yn y chwarter cyntaf. A'r ail yw, yn seiliedig ar yr adolygiad strategol, beth felly yw'n cyfeiriad ni o ran dilifro dros y blynyddoedd nesaf. A mae yna opsiynau yn y maes hynny. Ac am mis Awst, fel y cyflwynwyd i'r bwrdd mewn cyfarfod blaenorol, buodd na ddigwyddiad seibr sylwedol iawn gyda Advanced, cwmni sydd yn darparu y system i WCCIS Care Director. Ac bod effaith y digwyddiad seibr ar Astra, cynnyrch product arall sydd gyda nhw. Yn amlwg mae hwnna'n rhan o'r ystyriaethau sydd gyda ni ynglyn â dyfodol Care Director fel platform. Ac hefyd, mae rhanddeiliad wedi bod ar bwrdd, wedi bod yn awyddus i feddwl nid yn unig am y platform technegol, hynny yw Care Director fel un system digidol, ond hefyd y raglen, yr amcan, yr uchelgais o integreiddio gwasanaethau a trosglwyddo'r data o un lle i'r llall rhwng iechyd a gofal. Felly mae yna aeth y dasg tipyn bach yn fwy, a oedd y bwrdd yn awyddus iawn bod nhw'n gallu cael sgwrs mor llawn a phosib gyda'r rhanddeiliad ac yn teimlo bod e'n werth ymestyn y gwaith hynny am ryw 2 fis. A dyna pam oedd e wedi llithro dros y rhaglen oedd gydag i gychwyn.
Diolch yn fawr iawn, Ifan. Diolch.
Thank you, Ifan. Thank you, Marion. Carwyn, then Rowan.
Just checking him off mute. Yeah, I think I am. Right. I was going back to your question, Simon. I think it was you that asked the question about the capacity with the managers to support, new starters and other bits and pieces. And one of the things that the operations directorate has implemented, Marion George has been leading on this work on the software development side, is implementing a directorate management structure to sit alongside the technical resources. So historically, we've run a structure where the kind of head of department is the kind of technical resource and the overall general manager and all that kind of stuff, for the department. And this is bringing in a supporting structure to sit alongside the technical people to make sure that some of the work, as in organising the personal development reviews and other bits and pieces, can be done by others, so that it maximizes the technical time that they've got available to support their teams. So that's something that's already started. We've appointed a directorate manager, and she's now working on appointing her team underneath her. And we're going to also incorporate the ICT part of that directorate as well into that structure, sitting underneath the same directorate manager. So that will free up some time, as in the managers still have to be involved in undertaking the PDRs and so on and so forth. But at least it frees up some of their time.
Thank you, Carwyn. Rowan, and then Marilyn.
Thank you, Simon. Ivan, I enjoyed the canter about what we've done through what we've done in the last 6 months. Whenever I read this particular report, I kind of get a broad assurance. It's pretty much what I'm looking forward, for when across the various aspects of the organisation. But it did strike me, as I was thinking about this report, that as we look forward to some of the large programmes that we're delivering, and on the front of the report we have our performance scorecard. And there's been a couple of spaces for metrics under development for a while. And if I think through the consequences and impact of programs like the DSPP, some of the wider engagements around moving towards and delivering on a healthier Wales, some of the things around enabling people to engage with their data more and some of those topics. In our engagement and feedback panel, we've got 3 very clear metrics that really lean into the leadership of the service, the performance of our systems, achieving their service level agreements, and the sort of direct feedback into the loop through service desk. We don't really have anything yet that talks about the engagement with the Welsh citizen. And it just feels to me that there's a 4th corner there that we could be working on what those metrics might be and what we might be monitoring. And I certainly don't have a recommendation, but I was going to put the proverbial flea in the ear and challenge back to the exec to say, is it time that we think of filling that box, and how do we engage with the public? And Sam, I'm looking here as you've sat here and listened very carefully and let Ivan sort of throw the Wikis delay across your desk in a slight hospital pass. We're more supportive than that, of course. there's something there that I think is missing, and I would really like and welcome to see some development of that. So I'm not sure what the answer is, but I'm throwing out the question.
Do you want to come in, Ivan? Go on.
Yes, if I
and
could.
then I'll bring you in, Marilyn.
So, as I think you've heard me say before, although maybe translated, working with the performance and the planning teams, I've tried to emphasize evolution, not revolution. That is not an aggressive, destructive, radical, shake it all up, sort of change, but that we iterate rapidly from one board meeting or from one quarter to the next. And I think we need to keep doing that. I don't think the IOPR is in its final format. Simon mentioned the review that we're doing of governance of programme boards, and we've seen from our PAC committee presentation plus our JET meetings with Welsh Government that there still is a bit of confusion around accountability and governance of national programmes that we host. What does performance mean in that context? And Karen was reporting on how some of what we're reporting as issues, major IT incidents, are actually nothing to do with our managed infrastructure or our provided infrastructure, but it's a little bit more complex. So I think we need to get on top of that, because you're absolutely right. We do need to think about how do we in our performance review, our organizational performance review, present the progress that those programs are making on transformation and improving outcomes for patients. Historically, we've not delivered many services that have a direct impact on patients. We provide services that help clinicians to create the direct benefit for patients, but DSPP and the NHS Wales app is moving us into a different space. And I'm sure, that Sam will be leading more work in primary and community and mental health areas that will be moving us also into a more direct facing space. So we need to get around that. What I suggest is that we wait for the outcome of that governance review and how our IMTP process this year, which is slightly different to last year, how that evolves, and then start to reflect that maybe as early as January, but more likely probably in the March and then the sort of April-May board meetings. And I'm sure that you will be a flea in my ear continually to make sure that we do follow through on that and that we do continue to see the report evolving. And I just want to assure you that is our intent.
One of the things that's worth mentioning is that we were told yesterday that we're going to be given an IMTP template. And what will be interesting for us is whether that template works for us or is much more designed around clinical service delivery, health boards, but we'll see. Marilyn.
And Simon, by the way, I don't have an answer to it, as I said, but I do think it's something to start thinking about. It's not a fast thing.
No.
But that it was that box that sat me thinking, and I just wanted to share that with colleagues.
Yeah. Marilyn and then Chris, and we better move on to make sure that Claire has enough time.
Just want to say what Lauren's just said resonated with me, because that's one of the reasons why I want to be involved with DHCW. But just going back to the earlier point when we're talking about us marking our own homework, Alistair said, it's about sometimes perhaps creating a space for people, rather than asking them questions, to have a standalone item, or for us to think about the strategy in which we allow that freedom for people to come and tell us. Because if we only ask them when we want, or if we rely on them to go, the power dimension is not quite right. So if we put in our strategy that this is something that's ongoing that we want to continually do, I think that will create a lot of more willingness for people to have that space to say what they want to say, because it doesn't feel as comfortable as we'd like to think when you're new, and compared to when you're an existing member of staff.
No, it's that open invitation approach, isn't it?
Yes.
Yeah, absolutely. Chris.
Yeah, it's just to respond to Rowan's point around doing more citizen-facing engagement. I think the Citizens' Voice body comes into force formally, I think, on the 1st of April 2023. I think that's a really big opportunity for us in terms of partnership working, utilising their mechanisms to engage with Welsh citizens on the digital health and care agenda. And I know, Simon, you've met with the chair already and started some of that engagement work, but something that we should be building into plans moving forward, I think can help us actually in terms of that citizen facing work.
No, absolutely. And as people know, they've seen the correspondence that we've made it clear that when in taking on the data promise engagement work, there's a really important relationship with the Citizens' Voice body there in terms of what they're going to do and how they can be part of that engagement process, because so that relationship is was always going to be important, but with that activity on our books now, it's even more critical. So thank you all very much. Ivan, is there anything you wanted to pick up just in conclusion? I'll give you that opportunity.
Na, dim diolch. Wi'n credu ni cael digon o gwestiynau. Great, diolch.
Thank you, Ivan. Okay, if we move then on to item 6.2, and I'll invite Claire, the Director of Finance, to introduce the finance report. Claire, over to you.
Diolch,
As ever, we look forward to your slides.
Oh, good. Great. Well, what an intro. So we've had a busy month since we last met as a board. As Helen alluded to, from a financial perspective, that was brought up in the Health and Care Social Committee and Public Admin and Public Accounts Committee that we attended and supported. But that wasn't the only scrutiny that finance was subject to in the month. We had a detailed scrutiny with the Finance Delivery Unit on our forward projections and our current performance in terms of run rate, which I'll share with you in the forthcoming slides. We've also seen the outcomes from the work that's going on the strategic workforce group. So they are translating into some commercial packages that will underpin and hit the run rates in the second half year. And as mentioned, we have the link and RIS transfer that will undergo financial scrutiny and validation to ensure that we transfer those assets and construction in the appropriate and technical way. And finally, it's also worth noting that obviously it was a nail-biting another budget that we also witnessed with the new Prime Minister coming into force. And obviously the fallout from that and the implications for our budget allocations has been part of much discussion around the Directors of Finance table, which obviously I now sit at. So obviously we are now, our attention is now turning into quite some detail as to the opportunities and threats for next year in terms of the financial and economic position. So I'm going to summarise and take you through some of the DHCW highlights for the month as at the end of October. So if you could kindly move on to the next slide. So what am I going to cover? I'm going to summarise our overall strategic and statutory requirements in terms of financial performance. I'm then going to go into a bit more detail. I'm going to share with you those run rates that were scrutinised during the month and also then look at what that means for the DHCW Directorate performance, but also look at our savings, COVID, and our, importantly, the Digital Priorities Investment Fund allocation and progress to date. We'll then touch on the capital position, have a quick look at the balance sheet, and then I will share with you some additional information as what we're doing and what we're contributing to for the overall financial position. And then hopefully you'll be happy with that and sign that off. So if we move to the next slide. So the report will cover our core allocation. I know some of you had additional training this month from the Finance Academy, but we look at our performance against our core allocation. The COVID response, as we all have seen, our activity really reflects that upturn in COVID activity and rates. So you'll see the vaccine and the implications of that for us as DHCW. And then the Digital Priority Investment Fund, which we've touched on actually in the performance to show you how we are, what our financial trajectories are and where we are in that as we have passed the half year. So if we move on to the next slide. Against our statutory requirements, both from a revenue and capital position and also the way we pay our suppliers and our cash balance, all are in line with expectations and comply. I think it's important to note that we are slightly underspent. We are 437 underspent in terms of our revenue position. Capital similarly slightly behind, but as we see, the second half year is when our activity kicks up. And our cash position has fallen. It was over 6 million last month. We're down to 5.6, but bearing in mind our year-end target is a position of 2 million. If we move on to the next slide. So I talked about our run rates, and it's definitely a game of two halves, a bit like the Welsh game earlier this week. So if you look at the first half, actually our run rates were relatively flat. And I think that really reflects, and you'll see in the second half year, the impact of the Digital Priority Investment Fund coming in. And that funding, if you remember, we had a lot of discussion about funding letters and allocations. As they have now crystallised, you'll see the second half year, that activity really starts to to kick up. And the key players in that are, as what you would expect, the top 4 digital priority investment funds. So that's the digital services for patient and public. We talked about the private and public beta, that activity is obviously going to have an impact on our financial position. Equally, WCCIS and the medicine management programs, again, towards the second half year, you'll start to see some of the work packages and activities catch up. I think the worry for me is that there's a lot of activity in the last month of the year, and as a finance person trying to reach my 2 million cash target, that will create some challenges. But that's something we're working in detail with, alongside Evan and the team and the programme managers, to understand that and assure Welsh Government and ourselves that that is actually the reality. So if you move on to the next slide. In terms of our organisational performance, so as you know, we're split into directorates. And as you can see, there's, as you've seen in previous boards, actually most of those directorates are busy out recruiting, and that slippage is really reflecting the underspends across the board for most of those directorates. The touch point is obviously in ICT. And again, we've worked closely with Cadwyn and the team to minimise that impact and offset the cost pressures for next year. And we're doing a bit of detailed work in understanding what the recurrent pressures will be going forward, and therefore how we can fund and allocate our allocations to balance those out. So that's really the directorate allocations and performance, which leads to a 437 underspend. If I move on then and look at our savings plan, I think it's true to say that, unlike other organisations, we are delivering on our savings plans, and in fact our savings rate is influenced again by that vacancy and that pay efficiencies factors. We have a target of just shy of 2.5 million. We are anticipating we will achieve that, and that actually 1.1 million of that will be recurrent in nature. In other words, they will be sustainable. Again, I think going forward, this will be an area of focus for us next year, and across all health boards and trusts, this is clearly an area of focus and touch point at the moment. But generally speaking, we're doing well, but really reflecting, I think, those pay efficiencies that we talked about in the previous boards. If we move on. COVID then. So again, what we've seen here is a within track and trace, we've seen that spend really settle into what I would call the necessary fixed cost, really reflecting our licensing and support within that. And we are looking at how we minimise that in the next 2 quarters, but equally what the future expectations from Welsh Government are going forward in that space. Within the vaccines, though, as you know, and I'm sure a lot of you have had your boosters. Again, that activity is kicked up in September and October, and you can see there the consequences in activity from letters and texts, which then has an impact into the spend programme that we're doing. I would also say that we are doing quite a bit of modernisation work in this space, so that also comes into play later in the year in terms of the spend profile. That's COVID. If we move us on then and have a look at our Digital Priority Investment Fund, this is a significant allocation of funding from Welsh Government, 31.6 million. And what this chart really shows you is a split of that 31.6 million for the year by programme, with the dark blue showing you the actual and the light blue showing you the anticipated. Obviously, the top areas actually is where the most influence is. And again, we've done quite some work together with the programme leads to understand the sort of second half year profiles and the assurance around the delivery of that and the procurement underpinning it. So the National Data Resource, the Digital Services for Patient Publics, Medicines and WCCIS are the key areas of focus for us in that space. Having said that, we did reduce our allocation this year by just short of £1 million, and what the table on the right shows you is where that reduction has taken place. So actually, as we meet the half year, and given the funding letter position, I am reasonably happy with that trajectory. And also, we are now starting to see some of those deliverables, particularly in the digital services for patient and public, come into play, and therefore the spend profile is pretty secure. So if we move to the next slide, please. In terms of capital, we have 3 areas of capital allocations. One is our discretionary, so that is our allocation which was within our gift to allocate. As we already decided, we were focusing primarily on the NDC network, as we talked and Carwyn touched on earlier. Again, that the majority of that is going to hit in the last quarter, which is always nail biting. But we are reasonably, we're becoming more confident in our ability to deliver that now. And again, there's a few minor spends. In terms of the Digital Priority Investment Fund, we've got an allocation of 5.7 million, and to date we are broadly in line with plan, so no issues to date to report on that one. And finally, there is some minor capital spend in relation to track and trace and the vaccines. So I'll move us on and then talk about our balance sheet. And I love this, but I won't spend much time on it. We've got a balance sheet, so this is our assets, and as you can see, they are quite significant at the end of October, really reflecting the moods of the rules of the game that we play against. So IFRS 16 has kicked in, and we've had to adjust and reclassify some of our contracts within our balance sheet. The other big influence in our balance sheet is the Microsoft contract, which is again the way that we procure and act as the agent for all the NHS in Wales enables us to have a significant prepayment on the balance sheet. And again, that this is now something that we are totally in control of, which is kind of nice. And we are really looking to exploit the position on this every month together with Welsh Government, because obviously this has an impact on our cash. So I'll move us on. So in terms of the financial risks and opportunities, obviously we've touched on it before. We are highlighting digital inflation and supply cost increases. We are seeing the energy costs, and we do monitor the energy costs, particularly around the data centres. But equally, we've done a detailed analysis of our supply costs. And to date, we have mitigated some of those, but it's next year that we're really starting to see some of that kick into play. The opportunities, although I know I'm looking through this as a financial lens, is our vacancy position, which enables us to deliver on our savings, but equally enable us to look at third-party suppliers. We've had, and we continue to have, as a result of the hybrid working, travel expenditure underspends, and we are using our position contractually to exploit VAT. And we're looking to recover that this financial year, and we're working alongside the HMRC to enable that. And equally, we've done, as part of the balance sheet transfer, is we've looked at balances, old balances on our balance sheet, and we're looking to unwind some of those and support the Welsh underlying position. And finally, we've also done the analysis around track and trace, which may enable more releases for later in the year. So I'll move us on to the next slide. So to summarise then, we've had a busy couple of weeks in the finance team. What we have done is done a detailed forecast for the end of the year. We've been scrutinised by the financial delivery unit. We've also been scrutinised on our future strategy. From a financial revenue perspective, we're slightly under plan. And I think really that reflects the recruitment position, and that clearly is across the organisation. Equally, if you look at the COVID spend, we are seeing a bit of a kick up reflecting the vaccine rollout, and there's no surprise there. And equally on the DPIF, the 4 key programmes really dominate the spend profile, and we're really scrutinising those more closely now, particularly in relation to the procurement underpinning that. So that really summarises where we're at the end of October, and I would therefore request to the board that you accept and you approve the report. Thanks. Thank you.
Thank you, Claire, for that, as ever, very clear walk through where we are in terms of our finances. Anyone got any questions? You know, my everlasting observation is around the non-recurrent basis of our that we just need to be very, very mindful of it, because otherwise we do build ourselves misery on misery, don't we, year on year. Alistair.
Thanks, Chair, and thanks, Claire. That's really clear, and there's an awful lot of reassuring material that you covered there. It's just to inject a reference point for our key partners from the perspective of the NHS, key partners in local government. Their financial position, whilst it's different from one council to another, there are 22 in Wales, it generally looks to be about as severe a situation as certainly I can recollect, and Sam, you'll have some very close knowledge of this, but perhaps we'd agree, Sam, that it's about as serious a position as local government has been in for decades. So this year looks to be one of pretty much across the board very serious projected overspends against existing budgets, and next year looks like it's going to be absolutely brutal from the point of view of budget shortfall. And the reason I mention this is that, you know, we obviously need to be as cognizant as we should be as to our key partners across the system, but also just how this might back up in terms of, as I've mentioned in previous meetings, just whatever difficulties that might back up to for the NHS as a whole in terms of the impacts on capacity and resources with such an important partner in terms of, for example, social care. So it seems extremely likely that there will be significant downsizing of councils across Wales, across the UK, but across Wales. And whilst frontline services will always be the most protected, it's very difficult to protect all aspects of frontline. And there is quite often just a lack of good understanding. You can't have a good frontline if you don't have proper backup and support. So, you know, it's really just to give a reference point for this, for one of our absolutely central partners, that it would be not a big surprise to me if we actually get to what in local government terms is described in called Section 114 notices. It's effectively bankruptcy, where revenue for next year may simply not match the planned expenditure. That would not be a surprise. It, however, is extraordinarily unusual across local government as a whole. But that's how serious it is. So I just wanted to give a reference point for, you know, we obviously don't live in a sort of hermetically sealed bubble or anything. We're dealing with those very dynamic situations with partners, and I just thought it might be useful to feed in that as a reference point. But thank you.
No, thanks, Alistair. It is as grim. And am I right in that the Welsh Government budget of the date I've got in my head is the 13th of December? Is that correct, Claire? The publication of it?
Yeah, so we are, you know, we used to get it, I think last year we had it Christmas Eve, which was always lovely, isn't it? But yes, we're looking to get that mid-December. And look, I appreciate that there are some very difficult choices across the system. I would say, you talked about bubbles, I would say the NHS Wales bubble is under significant pressure, and we are using words like unprecedented. So it will create challenges for us. And I think the challenge to us is that we make the right decisions, because we will have to make some choices, and they are well-informed decisions. And I actually do see that digital, and we had a joint session last Friday with the digital directors of finance, the digital directors and the directors of finance, following a very detailed analysis of next year to really highlight what Helen's been trying to highlight, is actually the assets we've got and how we sweat them, and the investments that we are making that will come to fruition over the next 3 years that we need to exploit. And I think the investment in DHCW will yield those returns. And what we need to do is we have to work together and support each other, because the important thing here is the citizens of Wales at the end of the day.
Absolutely. Rowan, and then we better move on.
Yeah, just I think 2 points on with Alistair is one, I think we're all recognizing that that is the new normal that we're working against. Equally, what we're doing at Digital Health and Care Wales is part of the solution to helping people manage their health better, all of the things that we talk about. I do think, though, there is another consequence of this, which is as we are deploying systems into clinical environments that are under pressure, and people are working in very difficult systems, whether they're in a secondary care, a primary care, or a social care settings, those are environments that it's harder to land innovation in, because people don't have time to learn systems and think about them. So I think that's as much of the challenge as the lack of money. And I think one of the things that I draw heart from is some of the stories we've heard today, like the deployment of the WPAS in Velindre and the first step around Canisc. This organisation is proving that it can do these difficult things, with its clinical partners very well. And I think that's what we as a board have to keep front of mind, is how we enable DHCW to engage with the wider organisation and be that trusted strategic partner. So
thank you, Rowan. Okay, thank you all very much. Thank you, Claire, for that your presentation, your report. And as Claire mentioned, we've been asked to discuss the finance report, and obviously I think receive and note it as well. It's important that we do that. Thank you very much. If I can move then on to the next item, item 6.3, which is our half-year review of the Border Share Assurance Framework report. And Chris, you are going to introduce this item.
Thank you, Chair. Yeah, I'm going to run through some slides and bring exec lead colleagues in for each of the strategic missions that relate to them. So this dashboard will be familiar to a number of board members who've played quite a big role in its development over the last 12 months or so. I am conscious, however, that there are new board members, so I will run through the first few slides before I hand over to the exec leads with strategic missions assigned to them for them to update. And I would just note as well that there is additional work to support this dashboard. There's a spreadsheet with controls, assurances and actions that backs this up. So that is available for board members should they want more detail. What we've tried to do is for each strategic mission keep a position statement to one slide, which has been a challenge, but we've managed it so far. So I'll work through the first few slides. So the next slide, we will just start with our risk appetite position. So Rowan has mentioned this already. So this summarizes our risk appetite statement and our operational tolerances to risk. These were agreed by the board last year, and you'll note there are a number of areas where we are cautious or risk averse, particularly in relation to things like information storing and maintaining and citizen safety. And there are other areas where we have a more open risk appetite. We have now assigned risk appetite to each of the 5 strategic missions, which we'll come on to shortly. I think the one point from the risk appetite statement I just wanted to highlight was that was agreed by the board last year, was that DHCW must take risks to achieve our strategic missions and deliver beneficial outcomes to stakeholders. The next agenda item, item 6.4i, you'll see from the work plan, we are planning as a board to revisit this early in the new calendar year. So there'd be the opportunity to reflect on this, where we've got to and whether it's relevant as it is now. So if we move to the next slide. So this is the principal risk summary. So for each of the 5 strategic missions, there is a principal risk which is articulated on this page. Along with this, the risk scores, as was agreed as the initial risk score, as well as the target risk score we're working to achieving. And if we look at the next slide, we'll see through the heat map what the planned actions for 22-23 is aiming to do to aid the mitigation of the principal risk through effective controls, assurances and actions in order to continue to drive the delivery of each of the strategic missions. So the heat map just illustrates that generally we're trying to reduce the likelihood of the principal risk occurring and therefore increase our likelihood of achieving the strategic missions we're working towards. So the next slide is the assurance summary slide. So before I hand over to each of the exec leads for their strategic missions to talk through progress, any delays or concerns and their RAG score status, I just wanted to highlight the risk appetite for each of the strategic missions. So for the first two strategic missions, we are taking a cautious risk appetite approach. I think this reflects the high number of controls and compliance that we have in place around information governance and cybersecurity frameworks, as well as accepting very little risk that affect the delivery of our operational digital services and applications. In terms of strategic mission 3, we have agreed a moderate risk appetite, so we will take some risk to deliver expansion of the digital health and care record. Strategic mission 4, we are taking an open risk appetite, so we should expect to see far fewer controls in place and accept risk in pursuing value and innovation from data to improve outcomes. And the final strategic mission, we're taking a moderate risk appetite. And again, this is a very broad strategic mission, as Claire's update will no doubt illustrate. So you'd expect us to take a moderate amount of risk in order to pursue our strategic mission of becoming a trusted strategic partner. So I will hand over now to each of the strategic mission leads, and rather than coming back to me, if you could just hand over to each of them. So I'm going to hand over to Ivan, he'll hand over to Carwyn, back to Ivan, then Rydian and Claire, if that's okay.
Diolch yn fawr iawn, Chris. Felly dyma ni ar y sleid cyntaf. A wi jyst yn mynd i adrodd ar y rhesymau pam bod ni wedi gosod hwn fel amber o ran lle i ni, o ran sicrwydd, a tynnu allan 2 enghraifft penodol. Felly'r rheswm i ni'n amber yw bod ni ddim wedi gwneud y cynnydd o'n i wedi bwriadu gwneud neu amcanu i wneud. Yn gyntaf ar y strategaeth mae'n pensaerniaeth agored ac yn ail ar y gwaith o gwmpas yr addewid a'r ddata. Mae yna resymau gwahanol am y ddoi. A dwi ddim yn credu bod yna wendid gan unrhyw un, a wi eisiau atgoffa aelodau bod y gwaith yma ynglŷn â yn ei hanfod ynglŷn â dogfennu a gosod allan yn glir bod gyda ni y rheoliadau sydd angen arno ni a bod ni'n adrodd yn gyson ac yn llawn yn erbyn y rheoliadau hynny. Felly mae gyda ni gynllun clir o beth sydd angen i ni gyflawni o ran pensaerniaeth agored, llyfr rheolau neu safonau ar draws y system, ond mae yna bwysau sylweddol wedi bod ar y proffesiwn pensaerniol ar draws y sefydliad dros y 6 mis diwetha yn dilyn ymddeoliad i ni lawr un o'n prif penseiri neu un o'n penseiri uwch, a hefyd mae da ni 2 raglen sylweddol iawn, sef yr app a trawsnewid meddyginiaeth sydd wedi bod yn gofyn cryn dipyn oddi wrth y penseiri sydd gyda ni o ran cynllunio sut bydd y cynhyrchion newydd hynny yn cysylltu gyda gweddill ein systemau cenedlaethol. A mae yna flaenoriaethu angenrheidiol wedi bod ar rheini i chi gyd yn gyfarwydd sut mae'r gweinidog wedi bod yn gosod meddyginiaeth digidol fel prif flaenoriaeth i ni fel sefydliad. A wedyn o ran y cynllun, o ran yr addewid ar ddata, a ddechrau'r flwyddyn, o'n i'n fframio hwn fel ni yn cefnogi y Llywodraeth i arwain ar y gwaith hyn. Yn ystod y 2 fis diwethaf, mae'r Llywodraeth wedi gofyn yn hytrach bod ni'n arwain ar eu rhan nhw, a ni'n cyfathrebu trwy lythyr gyda nhw, jyst er mwyn bod yn glir ynglŷn â beth yn union yw gobligiadau hynny a sut fyddwn ni yn llwyddo i gymryd y gwaith yna ymlaen, a felly mae yna rhywfaint o oedi yn fyna. Felly, dim yn goch, ond yn amber oherwydd resymau a bod ni ddim wedi cyrraedd, le o'n i wedi gobeithio cyrraedd erbyn y pwynt hyn yn y flwyddyn. Does na ddim newid i lle ni eisiau mynd, a dwi ddim eisiau amlygu unrhyw risg sylweddol i ddarparu gwasanaethau na dim byd tebyg i hynny. A gyda hynna, na drosglwyddo i Carwyn, a wedyn, dewn ni nôl am gwestiynau ar y diwedd ar draws y 5, fi'n cymryd, ia? Carwyn?
Ie, diolch Ifan. Ie, bydd hwnna'n gret. So, eto mae gyda ni sgôr rag o amber fan hyn, a mae hwn yn adlewyrchu rhywfaint o gynnydd ac eglurder wrth ddiffinio'r strwythur a'r dull gweithredu fydd yn rhan o'n product approach ni. Ond mae angen llawer mewn fwy o waith yno ni ar hwn. Ni wedi gwneud cynnydd da ac yn symud yn ffordd o feddwl ymlaen, ond mae angen i ni gwblhau'r gwaith hyn nawr yn weddol gyflym. So i gefnogi hyn, ni wedi comisiynu adnoddau trydydd parti i yrru'r gwaith ymlaen, a ni'n disgwyl y bydd y cymorth hwn yn ei le am ryw 3 neu 4 mis, tan ddiwedd mis Mawrth blwyddyn nesaf. Ni wedi cael cyfarfodydd gyda'r trydydd parti i drafod ein gofynion a cytuno ar ddull gweithredu amlinellol, a nawr yn aros am gael cynnig manwl a ni'n disgwyl hwn o fewn yr wythnos nesaf. Un rhan allweddol o'r product approach yw gyda phrofiad y defnyddiwr, yr user experience. A ni'n bwrw ymlaen gyda peth o'r gwaith yma, ta beth. Mae'n pennaeth ymgysylltu ni yn dechrau ymhen pythefnos, a bydd ganddi hi rôl allweddol i'w chwarae. Hefyd, mae'n tîm desgwasanaeth wedi dechrau gweithio gyda'n tîm cofnod sengl i addasu'r system a'r broses adborth sydd gyda'r ddesgwasanaeth yn barod, ac a trealu hwn ar gyfer y Porth Clinigol Cymru, hynny yw Welsh Clinical Portal neu WCP. Y nod yw casglu adborth amlach gan holl ddefnyddwyr WCP am eu profiad o ddefnyddio'r system. Hefyd, ni wedi ailsefydlu mwy o ymweliadau a safleoedd ysbytau gan y tîmau technegol i gael pobl allweddol o'n tîmau ni yn siarad yn uniongyrchol gyda'r defnyddwyr terfynol i drafod eu profiadau nhw o ddefnyddio'n cynnyrch ni a sut y bydden nhw'n hoffi i'r cynnyrch yn ei gael ei ddatblygu. A nes bod y gwaith hyn i ddiffinio'r meysydd cynnyrch a gyda cynllun clir a cherrig milltir i gyflawni hyn yn cael ei greu, byddwn ni ddim yn newid y statws rag o amber. So allai llwyddo nôl nawr i Ifan ar gyfer misiwn 3.
Diolch Carwyn. Byddai'n gryno ar yr un yma. Amber eto, wy'n credu falle amber gwyrdd, ond wedi penderfynu yn y diwedd i fynd am amber. Fel i chi wedi clywed yn gynt yn y cyfarfod, ni wedi gwneud cynnydd da dros y misoedd diwethaf ynglyn â ymestyn y cofnod iechyd, enghraifft, i fel undre, o gwmpas cancer a phethau tebyg. A fel mae Carwyn newydd sôn, ni wedi penodi pennaeth ymgysylltu a chi wedi clywed rhywfaint am yr app a'r private beta a sut i ni'n tynnu adborth oddi wrth defnyddwyr mewn yn reolaidd. Felly mae yna cryn dipyn o gynnydd. Mae'n amber oherwydd yn amcan i fan hyn yw bod ni'n ffurfioli hynny fel ffordd o weithredu ar draws y sefydliad i gyd. Felly mae yna lot o bethau da yn digwydd, ond dydyn nhw ddim yn rhan o batrwm sefydlog cadar na sicr ar draws y sefydliad yn ei gyfanrwydd. A dyna pam ni wedi sgorio hwn fel amber. Mae yna risg fan hyn, bydd Chris yn sôn am yn yr adroddiad risg yn yr eitem nesaf, a mi wna i ddod nôl i wneud sylw ynglyn â hwnnw risg 299 yn yr eitem nesaf. A wy'n trosglwyddo i Rhydian.
Thank you. As you can see on this slide, the amber rating in the top right-hand corner is amber. The risk appetite, as previously articulated by Chris, is open. We've made some good progress during the last 6 months. We hit the key milestone with the development of the Digital Health and Care Wales Research and Innovation Strategy, and of course that was approved by the board in September, and we continue to have useful board development sessions on taking that forward. There are some areas, of course, that we still need some clarity. Digital Healthcare Wales functions regarding how we process data, and our work with Welsh Government, as highlighted by Ivan regarding the data promise, should put us in a better position to understand the what before we do the how. Finally, David Selway and I have been having some discussions about what value from data means. Here's some background in this from Rolls-Royce. So we've had initial discussions and we've got some follow-up planned for the middle of December as part of trying to work out that. I don't have any further comments to make on the slide. So I have to hand over to
me.
Claire.
Yeah.
Okay, so unlike my colleagues, I've ranked this green, and it really reflects the progress we've made on the action plan and the progress on the actions. So we went through it, and what difference have we made? Well, the ISO audits have been complete. We've had positive outcome, and as Helen touched on, the ISO 9000 and 14001 have done. The People and OD strategy has been approved by the board in September. And obviously, as part of that, we've laid out our plan on succession planning and the approach that we're going to take. So again, we are taking action on some of the risks we identified. The Health and Wellbeing Group has been established, and that reports to the Learning and Partnership Group Forum. The Head of Engagement has recently taken up post. Again, that will drive the partnership working, and the Assistant Director of Comms has been appointed and will join early in 2023. The Welsh Language Scheme has been approved by the Commissioner during this period. So again, we've taken steps to address that, and progress has been made working with Welsh Government on our 10-year sustainability plan for digital. So the group decided that actually we had made significant progress in tackling some of the action plan. That said, we did have quite a discussion on what Mission 5, what wasn't there that should have been there. For example, we've done quite a lot of work in CO2 that is really should really fall into this strategy and mission. So I think it's given us food for thought in terms of how we will update this going forward, and what we can elaborate on to this particular mission. So we ranked it as green. So I think I hand back now to Chris.
Yeah, thanks to all the exec leads for their updates. And I think, you know, this is for us an opportunity to make sure we are having focused time. We've got 5 strategic missions, and it's, you know, it's a priority for us as an organization to achieve those strategic missions. So this is our mid-year point where we reflect on how far we've come, how much we've done. And also, I think, as Claire alluded to, give ourselves a bit of challenge back. Are there things that are important to mitigate risk that aren't captured? So I think we've had a helpful reflection. Happy to take questions.
Ruth's got her hand up. Just to give Helen a heads up, I might be interested to get a sort of a global view, you know, almost like sort of, you know, we've had the individual diving down into each of those missions, but it would be interesting to hear from you sort of where you think we are across the piece, if you like. Ruth.
Yeah, did you want Helen to do that first?
No, I'll give her a moment. Give her a moment to ponder it.
Thanks, Chris. Thanks everybody for those updates. Very helpful. My question is actually for Alistair. Given your comments earlier, Alistair, around understanding how we link things back to our strategic mission and our key areas of focus, I was just wondering what we would need to do in these types of discussions around the BAF. And when you look at the corporate risk trend analysis, we talk about where our corporate risks are against our individual mission objectives. So am I right in saying that's what you were trying to get at earlier when you were asking about how do things link back to our mission? Does this go some way to doing that? Or are we missing something about how we feed this through the rest of the board conversation?
Yeah, as we were going through it, I was thinking that this is really good and it's all very helpful. I think part of it is probably about us asking ourselves if, you know, who are we trying to communicate some of this to? You know, we're in a public meeting right now, and, you know, if any member of the public were to look at this, would they be able to access this in a way that gave them the picture on the jigsaw box? And we can be clear about the parts that we play and the reasons for each individual decision around agenda items, but actually the level to which they relate critically to key objectives for the year, which is not the same thing as mission, but specific annual objectives. And I absolutely take the point that Ivan was making earlier about the IMTP will help to bring that out. So I'm not trying to be critical of this. I'm just thinking that perhaps we might want to just stand back and take a look at it and see whether or not we are making those connections in a way that we can be sure to ourselves that the decisions we make are relating to our core objectives. And part of that comes back to what I think Claire was just running through in the previous piece, which is we're, you know, it's not only other parts of the public sector that are going to be running into challenging times, it's our part of the public sector too. And that's going to lead to priorities and decisions being made, which is another way of saying, what will we not do as well as what we will do? And so, you know, all of that begins to make the clarity about, you know, the nature, if they are core or less core to our key objectives, become, I think, very important in our overall approach to looking at these things. I guess that's what I was trying to get across there.
Yeah, I mean, Chris, I'm sure you can take that away to give it some thought in terms. I thought I was on mute then.
No, you're good.
Sorry, people were looking at me from the other room, and it usually means I'm on mute. I do apologize. So you could take that away, I'm sure, Chris, and think about, you know, Alice's key point there around how penetrable is what we're presenting, and then that in the context of, you're absolutely right, Alistair, there's sometimes there's not a recognition that prioritization means that you do some things and don't do other things, because you can only afford to do some things, and we're, you know, almost certainly going to be getting into that space, aren't we, in the not too distant future. Any other comments or questions? If not, anything you wanted to say in conclusion, Chris?
No, just Helen, did you want to come in and comment? Just
yeah. So I guess a couple of things really for me. As chief exec and as the exec team, I guess the board assurance framework is a really, really helpful tool in terms of understanding where kind of our key controls and key control gaps are, and the assurance that we've got in terms of delivery of the objective. So as a tool for the organisation and the way we use it, actually, I personally, and I know the exec team, are finding that a really useful way of surfacing and connecting some of the kind of key controls that we need to have in place, and ensuring that we can manage and mitigate the risks to the delivery of our strategic missions. But on saying that, there's always more that we can do, and we know that I think that there are some key priority areas that need some real focus from us, and that is the area that we are spending quite a bit of our attention on. There'll be areas around the open architecture, as Ivan raised, in terms of Mission 1, and that whole piece around user experience and how we really engage with and then harness the feedback from all of our user base, and as we know, that will reach across and out into kind of patient and citizen facing as the DSPP program kind of becomes more successful. I think the things to call out, I guess, are the fifth mission, which is focused on us as an organisation and what we're doing in order to achieve and to be high performing and to be that trusted strategic partner. We've done a huge amount in that space, and this is the bit that for me, it gets us into the position of being able to be forward looking across all of the other missions and the stuff that we do, the things that we deliver. So I think that there's I feel really pleased with the level of progress that we've made, and in terms of the way that we surface that. I take the challenge on board, Alistair, I guess, in terms of whether this is kind of something that plays out well to a more public audience, and perhaps that, as you say, that is a fair challenge really, and something that we can take away. But in terms of a tool to support us in terms of managing and improving and delivering in the organisation, it is immensely useful for us as an executive team.
Thank you very much, Helen. Ruth, you want to come in?
Yeah, I just wanted to add to that really, because I think Helen captured kind of my thoughts on it. There is a difference between something that we want to use helpfully to communicate to wider stakeholders, including the general public, something that the exec can use to run the organisation, and then also something that we as a board can use to make sure that we're focusing our attention in the right places in order to support the exec in the running of the organisation. So I think there are, you know, there are three things here, and it can't be the same thing to all people, can it? And so I think that's what we've just got to be careful of, that actually we're focusing our time in the right place because we've got the right tools, but that we understand how we then communicate what we need to the wider audience. And that might be members of the public, but it also might be members of the clinical community. It might be other stakeholders out there. So I think that's where we need to just be careful that we're talking about the same tools and we're using those tools in the right way.
Yeah. Rowan, then we better move on.
Simon, I think you got us move on, because I think the next bit of the conversation feeds into how this impacts on the corporate risk register, and maybe pick up the conversation when we've done that. It was basically what I was going to say.
Yep. Okay, great. Thank you very much, Chris. Thank you for everyone who's inputted into that report and your presentation on your elements of the report, the framework. If I could then move on to item 6.4, the corporate risk register, and Chris, you again to introduce the item.
Yeah, thanks, Simon. So I'm going to start with 6.4 II and just run through some of the, I mentioned at the last board meeting, we were in the process of undertaking some risk analysis on the corporate risk register since our establishment. And we've had the opportunity since then to run that through the two committees and do some deep dives into some of the static risks. So I'm just going to talk this through quickly and summarize where we got to with the two committees. So if we move to the next slide, I'll just start with a bit of context, particularly for new board members. So we approved a risk and board assurance framework strategy at our board meeting at the end of May 2021. One of the key elements of that strategy was to assign corporate risks to each of our committees for additional oversight scrutiny. And another element of that strategy was that each corporate risk escalated would only go onto the corporate risk register with the agreement approval of the executive lead for that corporate risk, to ensure that ownership was clear on corporate risk going onto the register. Internally, we review all risks monthly at our risk management group, which is organisationally wide, and we also review in detail the corporate risks through our management board. Again, that's a monthly meeting. During the period, the 18-month period, so from the start of April to the end of September 22, we've undertaken deep dives on the majority of corporate risks by each of the committees. Not all of them, because a number have come on and come off quite quickly and haven't had the opportunity to deep dive. But certainly those that have been on for any period of time have had that period of deep dive through the committees. We have, as we just identified, started to assign corporate risks or organisational risks to the strategic missions to aid the understanding of the board assurance framework. The one thing I would say on this, that it's not an exact science, so there are risks organisationally that clearly map across more than one strategic mission. We've taken the approach to try and map them to one strategic mission, so there's clarity and there's not organisational risks on a number of strategic missions. And then as part of our plan for the year, we've undertaken this 18-month analysis. So the next slide takes us into the work we've done. So when we established, we had 14 risks on our corporate risk register. Over the period that we've looked at, this 18-month period, there have been 52 individual risks that we've managed through the corporate risk register. Of these, 7 have remained active throughout that entire 18-month period. So we've had 38 new risks come on, and we've had 26 risks where we've been able to mitigate them to either close them or de-escalate them off the corporate risk register. If we move on to the next slide. These are the breakdown of the 7 risks that have stayed on the corporate risk register for that 18-month period. I'm not going to go through them now. I'm going to go through them at the end, just because I've captured some of the discussions that we've had through the committees at that point. So if we go to the next slide, this just illustrates on the table on the right the 38 new risks that have been added to the 14 original risks and the 26 risks that have been removed. And then the graph at the bottom, the assignment of corporate risks, predominantly to the Audit and Assurance and Digital Governance and Safety Committee. And the next slide just highlights where the risks have been coming from in terms of the risk type. So the graph on the right just shows that of the new risks that have come on, the 38 since April 21, there's been an increase, particularly in the last 9 months, of the number of financial risks. So the 12 new financial risks and the 10 security risks. And I think committee members would probably recognise this. We've had a number of financial risks come through Audit and Assurance Committee, and clearly an approach to cyber where DG&S committee members will be aware that that number has increased, and we've taken a particular approach to try and manage and mitigate those risks, which are obviously being overseen by that committee. The next slide, I think, just shows as at the 30th of September, so this has changed slightly, where the allocation of risk is to each of the strategic missions. And I said it's not an exact science, but probably not too surprising that strategic mission 2 is where the majority of our risks are live digital services. And then the next slide, I think, just brings us back to those 7 risks that we've worked but haven't been able to mitigate. So I'm just going to run through these as we've done through the committees. We had an Audit and Assurance Committee in October and a Digital Governance and Safety Committee in November, where we've worked through these. So the Canis risk, as has been mentioned earlier, there was a key milestone achieved on the 14th of November. We're in the process of reassessing this risk, and I think Ridian's view, but we haven't done the full assessment, is we need to re-articulate this now as a new risk based on the current risk profile. The risk hasn't gone away, but it is a new risk reflecting a slightly different context. So that will change to some extent now the phase 1 go live has been implemented successfully. The Welsh language compliance risk, we've taken the approach to break this risk down. It was a very generic risk, and there were a number of areas across the organisation that we wanted to have very focused a look at. So recruitment activity, service desk, and a number of projects we've broken that risk down into. So that one has come off the corporate risk register now. There's a fault domains risk, which we had a good discussion at Digital Governance and Safety Committee. There is a clear target, and Carwyn has set out clear expectations in terms of when he will accept that risk being mitigated to a point that he's happy with, and therefore will then come down off the corporate risk register. And until that time, will continue to be monitored through that committee. Similarly, for the next risk, 0229 is a private risk, but just to give some assurance, again, Carwyn has a very clear target metric that we're working towards before we mitigate and reduce that risk score. New requirements and impact on resources on the plan. This is one we'll continue to monitor. We discussed this at Digital Governance and Safety Committee, and reflecting the numerous priorities that have that we've had to absorb, I guess, over the last 18 months. Similarly, the next one, which is a private risk, will continue to be monitored. That's been on since the start, since April the 1st. And finally, the staff vacancies risk, which is assigned to the Audit and Assurance Committee. as part of the process of the last committee meeting, Marion's asked that we do a follow-up deep dive into that one at the next committee meeting, particularly given the work of the strategic resourcing group since the last deep dive into that has taken place. So that's a quick run through of the trend analysis. I'll pause there, Simon. I was going to just run through the report, but I'm happy to pause here if it's...
Yeah, let's just take a moment. There's a couple of questions come up. Helen wants to come in and Rowan wants to come in, and then you can take us through the report then,
okay.
Chris.
Thank you, Chris. I just want to say how helpful I thought this report was actually in terms of understanding the way, the approach we're taking as an organisation to our risk register and to the management and of our risk register, and the way that we're assessing and using risk as a kind of a core, kind of central piece of our decision making in the organisation. I think that the report really helpfully demonstrates the way that the attention we're paying to it, but also the active mitigations and actions that are being taken forward to actually minimise or remove risks where we can, and to read across, if you read across at those ones that have been on there the longest time that haven't been moved off the register, and to the rest of the agenda today and what we are talking about, actually you can see there are key themes there in terms of the priority areas for us as an organisation. So I thought it was a really good demonstration of kind of the approach that we're taking as a board to risk and as an organisation. So I just wanted to thank Chris for that.
No, absolutely, Helen, absolutely. Rowan.
Yeah, and I think what I would reflect on is this document was incredibly useful at DG&S because it gave us a framework to have a discussion around that was really open and helpful. And I think I sort of took away a couple of sort of conclusions from it. The first is, I think the organisation has become more sophisticated in recognising risk and managing it. And I'll just generalise this. There was one large risk in the private theme, think of it as a big blob of risk. And there was a recognition that by splitting it down into, themes that broke it down with different actions that needed to be taken, we would get a better view of where we were with our big blob of private risk. And that's been very helpful. It was also useful because for me, who sits on the committee, there are some dynamic risks that probably pop onto it and almost move off before they've come through the review cycle. So there is more activity in terms of the organization's risk management than is perhaps apparent if you sit on the board. So that was a very useful conclusion. I also thought it was just very, very useful to reflect on the sticky risks, the ones that are persistent. They're not ones that we necessarily are comfortable living with, but we are doing all we can to manage them at the lowest possible level, recognizing that isn't necessarily a level that's consistent with our board assurance framework. And I think, Ruth, it kind of comes back to the conversation that we had when we approved the board assurance framework, originally, that we will have to break some eggs to make our omelette, and maybe we can become a little bit more open in certain areas, either by exception or as we gain comfort across the board. And then that also means that we have to think about what are the operational consequences of it and where that managing of that risk lies within the organisation. But I did think it was very, very helpful and useful and something we probably will continue to do. Not every meeting, but at least annually going forward.
Thank you, Rowan. Marion, you wanted to come in.
Just very briefly, echoing some of the comments that Helen and Rowan in a sense made earlier. I think this is hugely helpful report in that it helps us reflect on the huge progress that's been made over the past 18 months. So, big thanks to Chris for bringing this to the board in this way. And I think we're hugely fortunate in having in Chris someone who, has exercised such rigour within this process, and it's hugely helpful for me as chair of audit, and I'm sure for Rowan as well, in terms of getting to grips with the detail and knowing that we have now finally a system, albeit evolving, and will continue to evolve, I'm sure, but within that board assurance framework, we've got a system which brings us, great assurance. So thank you for bringing this today, Chris.
Diolch, Marianne. Chris, back to you if you'd like to move then on to the sort of the update report and where we are with current risks. And
yeah, absolutely. So item 6.4, so that was the backward look. This is the current position. So just going through the report, section 3.6, there are 26 risks on the risk register, 16 of which are detailed in the papers. The others are marked as private risks. But I will just run through the changes, because although there's 26 risks now and there were 26 risks at the end of September when we looked at this, 4 have come on and 4 have come off. So just to make board members aware of what those changes were, a risk has been escalated through with Ridian's approval, DHCW 0296 around allergies and adverse reactions. This is around ensuring there's a single source and a standardized structured approach that Ridian has escalated onto the corporate risk register. The second risk, I'll run through them and then take any questions if that's okay at the end. Yep. 0297 power outages. Again, this is a risk that has been escalated through with Claire's approval around potential risk around power outages. Pleased to say, so this came through the Local Resilience Forum and DHCW's own internal mechanisms, but pleased to say there's been some work, I think this week, to test outages and contingency plans in place, and there are workarounds. So this one will be de-escalated relatively soon. 0298, the delays in the implementation of Link. I think it's worth just reflecting on what Michelle mentioned. This service hasn't transferred formally to us. It does on the 1st of January. However, clearly there's a risk that has been identified, and board members will note it's now our joint highest risk on the risk register, so a significant one for us to manage. We did have a long discussion at this at our last management board meeting, and as Michelle alluded to earlier, we will be having a paper in January which sets out, when the service has formally transferred to us, the current status, as well as all the risks and mitigation plans for each of those risks. So there'll be a bit of a focus on that in January, and we will work through how we bring that through to board. The final new risk is DHCW 0299, supplier capacity to support electronic prescription service for readiness activities. I am just going to bring Ivan in on this one, because this was one that Ivan mentioned through the BAF, and it's a new one that he's approved to go onto the risk register.
Diolch yn fawr iawn, Chris. I ni'n dibynnu ar cyflenwyr eraill mewn sawl maes ar draws nifer o'n rhaglenni. Mae hwn yn benodol ynglyn â'r rhaglen trawsnewid meddyginiaeth. Un elfen o'r portffolio hynny yw trosglwyddo presgripsiwn drydanol neu'n ddigidol yn y maes gofal cychwynnol, ac i wneud hynny ni'n defnyddio adnodd o'r enw EPS, Electronic Prescription Service, sy'n cael ei ddarparu gan NHS digidol yn Lloegr. A mwyn cael hynna i gyd i weithio, mae angen gwaith gan NHS digidol yn Lloegr, a mae angen gwaith gan y ddoi brif gyflenwr sydd gyda ni o feddalwedd yn y maes gofal cychwynnol, sef Sedgdim ac Imis. Mae angen i ni'n negodi gyda nhw bod nhw yn blaenoriaethu'r gwaith hynny yn eu rhaglenni nhw hunain, a mae nhw, fel ni, yn gwynebu cryn dipyn o stretch ar draws i gweithlu. Mae nhw'n blaenoriaethau corfforaethol nhw hunain, ac mae NHS digidol wrthi yn cael ei amsugno mewn i NHS Lloegr ar hyn o bryd. Felly mae yna lot fawr mewn mlaen iddyn nhw, ac wrth gwrs mae rhaid i ni felly negodi a dod i gytundeb gyda nhw, a fedrwn ni ddim dibynnu bod nhw'n mynd i blaenoriaethu pethau oherwydd bod ni angen nhw. Felly i ni adnabod hynny fel risg. Does dim llawer fedrwn ni wneud i reoli risg na heblaw gweithio'n agos iawn gyda nhw i geisio lleihau'r tebygrwydd bod hyn yn digwydd, a dyna sy'n cael ei adlewyrchu ar y gofrestr.
Thank you, Ivan. Yeah, I think that's an important one just to note because it is a new risk that's been escalated on. Just to run through those 4 risks that have been removed. So unfunded, the national insurance increase, that has been on for a little while. Change in policy has meant that one's now come off the corporate risk register. 0294, our service ownership and resource commitment for the NHS Wales app. That's been reduced to directorate level. Fair to say there's still a lot of focus on this one in terms of risk as we move through private beta and learn lessons. So I know a lot of work's going on with that risk, although it has moved off the corporate risk register at this stage. The Welsh language compliance risk, as I mentioned through the trending analysis, we've taken a similar approach actually to what Rowan described for the private risk and taken this off and put a bit more targeted risk around a number of Welsh language areas. And then finally, in terms of reduction in risk scores, the network delays in equipment for the data center 2 move. Again, this one's reduced assurance has been provided from Carwyn, so we're confident on that, and that's come off the corporate risk register. Just to flag the heat map report, as I mentioned, the link risk has now come on as our joint highest corporate risk, and CANISC remains on there, just noting that we are in the process of doing that risk assessment. And then finally, just ask board members to note item 6.4i, the work plan, because we will be revisiting our risk appetite in the near future. So we'll have the opportunity, I think, to build on some of the discussions and conversations from today. Thanks, Chair.
Thank you, Chris. Helen, you want to come in?
Thank you, Simon, and thanks, Chris. I think it's a really helpful run through. I've got a couple of comments. One is just a minor point, but I think that on risk DHCW 0296, the allergies and adverse reactions, I think the description probably needs slight amendment in that it's, if you look at the resulting in, it says resulting in patient harm due to missing or outdated information. I think probably that should say potential patient harm, because we couldn't be sure of that. I think it'd be helpful if it was updated to that. I just wanted to also mention on the link risk. So that's a risk for us at the moment. We have actually agreed a risk to go on all Health Board and Public Health Wales actually risk registers to in terms of the link programme at the moment. So we'll probably look at whether there will be an additional risk that will come onto our register, as Chris mentioned, to be consistent with other colleagues for January. And I guess just one to point out when we look at the cancer risk and the CANISC risk, I guess normally where our risk scores are reducing, it's often reducing because the likelihood reduces. I guess with CANISC, what we'll be doing is looking to see whether the impact of any impact or the risk of CANISC actually now will be as severe. So just a reflection for me on that one. Actually, it's a bit more unusual in that sense, isn't it? But, yeah, thank you, Chris. Really helpful update.
Thanks, Helen. Okay, Chris, it says to discuss, but we receive it, obviously, that risk report. I think it's important that we minute it that way. And note, don't think there's any other contribution. Thank you very much, Chris, for taking us through that. If we then move on to some reports from committees that have happened since the last public board meeting, and the first is the Audit and Assurance Committee highlight report. And Marion, is there anything you particularly want to pull out from the written report that we have in front of us? You're on mute, Marion. Don't worry, it had to happen at some point.
Thank you, Chair. Diolch. Ie, wel, dyma'r prif bwyntiau a drafodwyd yn y cyfarfod. Gai just yn eich sylw chi at y gwaith neithbwyd ar ddad-garboneiddio, hwn yn destun canolog yn ein cyfarfod diwethaf y 19 o Hydref. Ni ddaru ni dderbyn adroddiad ansoddol ar ddad-garboneiddio a gyflwynwyd i Llywodraeth Cymru, ac oedden ni'n arbennig o falch o dderbyn y sicrwydd o'r cynnydd sylweddol dyn ni wedi weld fel sefydliad o ran gweithredu yn cynllun strategol ar ddatgarboneiddio. Gaethon ni sesiwn plymio dwfn deep dive ar yr risgiau cyllid yna, glwsoch chi Claire yn sôn amdano fo, ac oedd hwnna'n sesiwn hynod o fuddiol. Ac ai jyst yn ola gyfeirio at y diweddariad gan Archwilio Cymru, fe glywon ni fod y gwaith ar yr asesiad strwythuredig blynyddol, a dyma'r asesiad cynta o'i fath i ni fel bwrdd. Bydd hwnnw fwy neu lai wedi gwblhau erbyn hyn, ac so mae'n mynd i fod yn garreg filltir bwysig i ni fel bwrdd, ac byddwn ni'n edrych ymlaen i dderbyn y copi terfynol yn gynnar yn y flwyddyn newydd, a'i ystyried yn ffurfiol yn y pwyllgor archwilio nesaf. Diolch yn fawr.
On that, Chris, I know we've got some time carved out at a board development session to have a first look at it. When would we, as in public board, what meeting would we be considering receiving that report at?
Yeah, it wouldn't be till January. But we are planning to do that informally first.
Yeah. Okay. Thank you, Marion. And any comment or questions? No, we received that. The report of the audit committee. If we move on then to the Digital Governance and Safety Committee, any highlights that you'd particularly like to draw to our attention, Rowan, for the last meeting, which I think took place on the 3rd of November?
Thank you, Simon. So I think people will have read the report that's in the packs. It was a pleasure to have Marilyn join the committee. So great to have you on board, Marilyn. We had a really good discussion, and if anyone listening is interested, you can also download the public session. And I would recommend, in particular, the Keeping Patient Data Safe discussion, which was led by Darren Lloyd. That was particularly excellent. The sort of two risks that I will just remind the board that they will have read about in their papers really relate to the Welsh Emergency Department System, the WEDS programme. That's been rolled out as a minor injuries unit. You know, that there is further work required before that can be deployed elsewhere, and there is good work going on to get that program back on board. And then there was a very strong discussion in the private session about the consequences around obsolete and legacy systems and infrastructure. And I know that there's some work going on amongst the exec team that will come back and give us an update on that. But I think that's enough for now.
Thank you.
The rest is in the report.
Thank you, Rowan. Any comments or questions? Okay, we received that report as well. Thank you very much, Rowan. If we move on then to the Local Partnership Forum, which I believe was chaired by you on the last occasion, Andrew. So is there anything you particularly like to draw our attention to in the report that we've received?
It was indeed me. So there's no items to escalate to the board. It's just really to say that I just wanted to assure members that despite the fact our work's spread so widely throughout the organisation, it continues to be a very successful forum. And just to say as well that the Local Partnership Forum is just a very small snapshot of all the work that's happening daily within the organisation that we often don't get a chance to discuss. Really, we're continuously working. And I mean the items that are in the report. A lot of them are on today's agenda. I just wanted to really highlight the good work that continues to be done, and indeed all the other groups in DHCW that feed back to us from workforce-related items, really. And a big thank you to the corporate team, because they're the ones who make it happen so seamlessly.
Thank you, and
questions.
Thank you, Andrew. I think the work that this committee does and the wider relationships between the organisation and the staff are going to be particularly important over the coming months, because, as we know, staff throughout the NHS and ourselves, including ourselves, have a particularly difficult period of time in making decisions around the pay offer, and hopefully the relationships we have through this committee and wider will help us through, say, what's going to be a pretty difficult and testing period in the NHS right across Wales. So thank you for your continued chairing of that co-chairing with Helen of that committee. And I move then, so receive that report. I'm sure we're happy to do that. And I move on to, which is me, the Remuneration and Terms of Service Committee highlight report. We only considered one item, which was to ratify the terms and conditions terms of service of the interim and substantive executive director of operations, who I'm assuming will be with us when we next meet in public. I think that's the case, isn't it? So that'll be nice. We will then, so all stay safe, because we will then for the first time have an absolutely full and complete board. I haven't had any urgent business communicated to me. The date of the next meeting is, the public meeting is Thursday the 26th of January, and I am reluctant to do this, but I suppose I ought to, given that it is the last one, to wish you all a happy Christmas. Welcome, see you back in the new year for the next public meeting. We obviously have other engagements between now and then that the board will be undertaking. So thank you all very much for getting us through, helping me get us all through the meeting this afternoon and today on time. Take care, everyone. Bye.
Thank you.